I'm just making things look easy.
Look at the doggy.
I'm here today with my puppy Sky for a health checkup. You don't want to be up there?
Hey. What's up, baby? How are you? So how old is baby?
4 months.
Has it had any vaccines or anything yet?
No.
This is the first time around, okay. So how much you think this baby weigh today? What you thinking?
I think at least 120.
How much you say?
120.
120 pounds?
Or 90.
Oh, way down. Now look, I need to always bet against you. Cause I'm gonna go under. I'm thinking like 21 pounds maybe.
She a bit heavier than that.
We're gonna have to take her back here for some proof, okay? All right? All right, let's go. The owner is not a very good guesser as far as this dog's weight. I don't know if I ever had anybody that far off. You know, sometimes we all 5 pounds here or 10 pounds, maybe even 15 pounds. Well, we got a 9, but it's in the wrong place there. So 29 pounds, that's about right. But we were off, what, 70, 90 pounds? That's a long way. I wish I had a big dog around here. I'll show you. Definitely we had to give her a little lesson on what the dogs look like, what weight they are, and let her see what a dog that's over 100 pounds really looks like so that she'll know the next time somebody asks her what a dog weighs.
Oh, my God.
See right there? No, that's about 100 or a little bit more right there. Dr. Hodges, ask her how much she weighs. That's her baby.
How much you think it was?
I said 90.
So she said 100 or something at first. So I wanted to show her what 100 something really look like.
So you like 6'5".
So now you got a good visual, right?
Yeah.
What that 100 pound look like?
He looks more than 100.
He probably a little bit over 100. You think you can carry him around like a baby? You can do it. All right, so what we need to do today is we need to get caught up on these vaccines, okay? One of the main ones is what we call parvovirus. So we're gonna give that shot, and we're also gonna give a rabies vaccination. This baby had a good exam. We're starting those vaccines now.
Yeah, good girl. Good girl.
Look at that.
Yay.
So in a couple of days, that immunity will be built up, and Sky's gonna do well, and she looks good, and we'll continue to gain weight, and maybe we'll get close to that 120-pound guesstimate that we had. All right, all good. So we got your baby vaccinated. Okay, so in 3 weeks, we'll have to boost to that. Other than that, baby's good.
Okay. I'm glad that she's very healthy, and Dr. Ferguson is a very funny guy. I think this place is very entertaining, and I love bringing my dog here. Come on, Sky.
Your dad jokes really get the clinic going. They're really good.
They're serving their purpose, right?
They definitely serve their purpose.
Boost morale around the clinic, man, because there's some tough days around here sometimes.
For real, it really gets stressful.
Once though we get kind of stressed a little bit, we kind of have to blow it off so that we're ready for that next client.
Whether it's some kind of feng shui, whether it's just meditating to yourself, whether it's just going in the corner and read.
Or my dad jokes.
Or your dad jokes. But I got something else that you might really, really, really enjoy.
You making butter?
Hey, baby girl.
I know, baby. Hey, Brandy. I know. Today I'm bringing in my guinea pig, Bendy. I have 2 guinea pigs, and he is the feisty one. Hello. Bendy is definitely my problem child.
Hey, what's up?
Hello.
All right, so we got Bendy here. So tell me a little bit about Bendy.
I brought him because I think he might have like a corneal ulcer or something.
Well, you been studying.
I major in zoology.
Okay, I just say that. Most folks walk in and say they got a scratch on that. Really not every day that a client comes in and tells me, my baby has a corneal ulcer. But she's studying zoology, so she may just know what she's talking about.
I figured he would need like a stain or something.
Okay. She gonna teach me in here. Before I even get started, you know? To check and see if an animal has a corneal ulcer or abrasion on the eye, we use something called a fluorescein stain. A fluorescein stain is actually a dye that we put on the eye, and when you look at it with a black light, if there's an abrasion, it definitely lets us know. What's the most important thing with this?
To make sure that it doesn't have like the indent in his eye.
That is perfect.
And it shows the infection.
That is perfect. But that ain't the most important thing. Turn off the light.
Yeah, the light.
So what I'm doing, I'm just kind of grabbing. Ooh, boy. We have ulceration on the eye.
Oh, my.
And this fluorescein stain on Bendy definitely reveals that Bendy, in fact, does have a corneal ulcer.
I don't know how it happened. maybe the hay was too hard and it might have...
That's kind of what it looks like. So we're gonna do a couple things. One, we're gonna give him something to take care of the pain, and then I'm gonna get you an antibiotic to help, and then we're gonna give him gel to heal it. My plan here is to use the gel that helps replace some of the cornea. Putting this gel in is very, very delicate because if you scratch their eyes, you could possibly make the cornea also worse. What we do is we go to the side. So if we go like this, just like so, this one, then massage it in. And that's all you gotta do. What you studying?
I think I'm gonna do, like, the whole land animals thing. Like, hippos are some of my favorites. I really want to work with those.
So if a hippo got an eye problem, don't come to me. But good call. You was right on the money. Bending's ulcer is very treatable. It's also really cool to show someone exactly how to treat a corneal ulcer, especially someone who's interested in animals in a veterinary career. You gonna do well, and just let me know. Maybe I'll come assist you with some hippos. I ain't gonna be primary on no hippos.
It was all just a really good experience. I would think about volunteering here because all of the staff is really nice, and I think it would be fun.
How you like this guy? I'm actually allergic to rodents.
You didn't tell me that in the interview.
Lay down. My dog, my golden retriever, his name is Thunder. I noticed a cyst that's not normal, so I felt like I needed to bring him in to have it seen. And he is the most loving dog. I mean, he's at my feet all the time.
How you doing?
Hello. Hey, how you doing?
I'm great. How about you?
Good. What's going on with this baby?
Under his neck, he's got a big old red, I mean, it's like, sit down, Thunder. Let him see your neck.
Let me look here.
Oh, Thunder, I know. It's okay.
It's okay.
Hey.
You can lay down. You can lay down. You can lay down.
There you go. Get some belly rubs.
Yeah.
Oh, was like a mask?
Yeah, he got a little growth there. And it's gotten red and ulcerated there. Thunder is presenting with a mass on his neck. It is something that concerns me because it's on the neck and it's raised up and it's real red and irritated. He like a little tumor, probably not cancer, but you really don't know until we take him off and send it to the lab.
Got it.
So my recommendation here is that we take this thing off.
Okay.
And we can do it today.
Okay.
You gonna win for me?
Yes, sir.
All right.
Come here, eat some.
My initial thought after looking at this growth is that it's a wart. But after looking closer, it's red, it's ulcerative. We need to do a histopathology to get a definitive diagnosis.
All right, Paul.
Looking like a surgery case again.
I want to get this growth off as fast as we can because if the report comes back and it's cancer, we give it a couple of days to metastasize, and that's not what we want to do.
Look at that.
Yeah, so making my initial incision here, this thing is what I call hot because it's red and ulcerated, but at the same time, we're sitting pretty close to the jugular, so I don't want to hit that. So we're in an area that's real tight.
Better to be conservative, huh?
Okay. That one just look like
A wart?
like a wart. It could have started out like that. That'll be good if it is. A larger wart that became ulcerated because it was scratching at it. But they always scare me when they're red and ulcerated like that. I always hated warts, Jordan, but then they grew on me.
That was very cheesy.
All right, then that didn't pass the test. I liked it though. So we'll get this growth prepared and sent in to the pathologist once we get a report back. Hopefully the report is clean.
Good job, Doc.
Surgeon went great today. We got that growth off. We got it sent to the lab, and we're going to discharge this baby and let the baby go home. And hopefully, fingers crossed, the results come back and everything is negative, and this is just a benign tumor. Thunder's doing good. Thunder's still a little woozy there. All right, so there's a possibility that was just a larger wart. We've been scratching it so much that we broke the skin there, and it was red from there.
Okay.
But it worries me sometimes when they are red because that can mean we just use the word they're hot, or it can mean cancers.
Right.
So we got meds going home, antibiotics, and pain anti-inflammatory.
Okay.
But come on back. You come back.
Okay.
See.
I'm really concerned because I don't want it to be cancerous. Your mind kind of jumps to the worst case scenarios. Right now, I'm just hoping that it's something that can be fixed quickly. How you doing? Hey.
Oh, he knows you. He's trying to get up. He's trying to walk to you.
Hey, buddy. All right, well, thank you.
All right, no problem at all.
She wants to get out.
Yeah.
Take her out.
We came here today because my cockatiel Ray
hasn't been feeling very well. It looks like her wings are drooping, her head's up high. Look, she's having a hard time breathing just a little bit. She's my family member, she's my baby. And
I like watching her fly. I love watching her fly because it sounds like a little helicopter in the room. She can fly so beautifully.
Hey, y'all.
hello.
How you?
I'm just fine.
Thank you for your service.
Yes, sir. Anytime.
All right. Tell me about this baby.
Ray, I believe she's egg binding.
Okay.
I'm not really sure, but her body shows that she might possibly be going through it.
Egg binding occurs when a bird cannot naturally lay her eggs, and they become stuck.
It's okay, Ray.
I'm feeling an egg right there, but I'm gonna go X-ray and take a peek.
Okay, thank you so much.
All right, let's get you back on in here.
Egg binding can be really, really serious. All right.
I hold this tail a little bit.
It just kind of depends exactly where the egg is located in the oviduct. If it's high up, it requires surgery. If the egg is broken and there's yolk in there, you worry about septicemia. If it's lower, maybe I can try to manipulate it. But I'm kind of gonna see where we are. Oh, boy. Let me talk to Mom. I think we got several problems. You see that outline?
Yeah,
What that look like?
I don't know.
It's an egg.
It's an egg?
You
Oh,
see?
okay, it is.
Can you see it? There's not much calcium in that egg. It should show up like bone. What kind of food do we eat?
Mostly seeds.
The seeds don't have quite the nutrition. We don't have a lot of calcium. The bones are hollow. And I can try to see if I can surgically get it out, but I'll be honest, I mean, we're talking kind of the shape the bird's in.
Mm-hmm.
Chances of survival is real low.
God. So there's no other way of getting that egg out?
I can try to manipulate it through the collector, but it's so big. It's just so big.
God.
I really would like to manipulate this egg out, but looking at how fragile it is, if this egg ruptures, it could possibly cause septicemia as well as cutting the internal organs of this bird.
Oh, man, that's all.
Oh, boy. I'm trying to manipulate this egg out of here using mineral oils, but it don't seem like it's gonna work. This is pretty bad. I can't manipulate this egg out. This is like life-threatening bad.
You can't do a surgical or anything?
Even with that, your odds are really low.
So what happens if she just let her stay like this?
She's gonna die.
Okay.
What would you prefer?
I would think, I probably would give it a surgical trial. This bird is like I said, it's not in the greatest
Great shape for it.
This egg possibly ruptured inside the body, but if we go through, then you would have the normal.
Oh, she'll be fine? Okay.
If we can get through that, yes, ma'am.
Okay, yeah, I'll do the surgery. I want to try. I can't just, oh, God. My nerves are going bad already.
It's quite a challenge to remove this really thin egg because just the wrong amount of pressure and this egg will rupture. This bird may not make it off the operating table. How's you doing?
Heart rate's good.
I think.
Uh-oh. Did the egg rupture?
I think it's already broken.
Oh, wow.
Yep, I'm trying to get this yolk out quick. This is bad. It's a good thing that we went to surgery because this egg is definitely ruptured inside the body. So I gotta get this area flushed out really good because you have a great chance of septicemia. Got the yolk out, the remnants of the egg.
All right.
All right, let's get it off the table. My worst suspicions on that bird's egg were true. I mean, it is so paper thin because it has no calcium. I mean, that's the egg. It's so thin, it's just curling on itself. It's just like paper. How my heartbeat, boss?
Good.
If I didn't get the egg out, this bird had no chances. As you work, you can literally feel the heartbeat in your hand. And you feel the heartbeat, you feel this emotional toll, you feel one false move, and that heartbeat stops. And you just hope that heartbeat don't stop. As you took some years off my life, you walking around. Guess I'll call you, Mama, see how you doing. Somebody need to call me and see how I'm doing, too. All right. We made it off the surgery table.
You got off the surgery table?
Yes, I got the egg out.
Okay, thank goodness.
We worry about something called peritonitis or septicemia.
Okay.
I've given antibiotics, I've given pain medicine. We're walking around.
Okay.
But we'll say our prayers tonight and cross our fingers and hope everything works out.
Oh, my goodness. Thank you so much.
Yes, ma'am.
Okay, take
all right.
care.
All right, you too.
Bye.
Wow. Ray definitely will spend the night here at Hotel Hodges. It's gonna be a rough night, you know. We gotta try to make it through this night and kind of see how we're doing in the morning. But the time clock is ticking, and we'll see. That's tough.
Hold on.
Dr. Hodges tries to ring in some calming vibes.
Hold on now, what we got now?
It's ringing a bell. We talked about turning some funk sway around here.
Oh, yeah.
You said I'll keep it ringing?
Meditation.
I feel a certain way there, too.
Me? And then you gotta keep it contact.
Huh?
What are you doing?
This thing is a magnet. It brings people in. See how you just showed up?
How about
How you come back with a bigger bowl?
Yeah.
Oh!
You hear it?
Now you gotta scare me.
There you go.
Hold on, am I still here?
Come on, keep going, keep going. These are Tibetan singing bowls used by ancient Buddhists to kind of promote relaxation and healing, man.
Buddhist singing bowls?
Now, you've come in my office many times, and you've seen those bowls. You never wondered what this bowl was?
I'm afraid to ask her. that was really one of them times like, that's his bowl? You do your thing.
Michelle, you ever run a bell?
I mean, I've seen y'all ring a bell.
You heard it too, huh? Hey, hold on one sec. Shh, shh. You don't hear any dogs barking, do you?
Hey, don't stop the dogs. I'm telling you. That's why I got these bowls on my desk. When y'all be talking.
Hey, you need a bigger bell for some of them. You need to bring a Liberty Bell.
I need everyone on deck. Cold blue.
Calm down, Double.
Emergency case, Coda the dog, rushes in shaking violently.
I got no history, Doc, but we was outside.
All right.
I had one of them give me a bag of fluids.
You got it?
Count 1 on 1.2.
So I can get a diazepam on board.
I came home from work today, and Coda was seizing, body shaking, so I brought him immediately in.
Okay.
He's my daughter's dog, but he's my partner in everything that I do. He's my protector. So I have a very strong bond with Coda.
Did we get the diazepam, Drew?
Yeah, she got it. That's why she don't calm down a little bit.
I need to talk to the owner. There's so many things that can cause seizures. I mean, you got toxins, heat stroke, so many ways my brain go when I start to see a seizure, dog. Just got to get to the bottom of it. I got blood going, but anything you saw that looked different? Anything you can think of?
I rinsed out a trash can.
Okay.
Left a piece of a nasty sandwich there.
Okay.
Had green mold. He ate a tiny piece.
Okay.
This was less than an hour ago.
Okay.
Ran in the house, threw it up immediately.
This is a huge revelation. There's mycotoxin, aflatoxins in this mold. And what happens is they go inside the body and they cause seizures and they also destroy the liver, so they can be very dangerous. More than probably some kind of toxicosis.
So yes, definitely good to bring him in because he scared the fool out of me.
He might have not been with you. Is that serious?
Okay.
All right, give me 1
Thank
second. I need something to get this guy to vomit. Somebody.
Vomit?
Yes.
How much does he weigh?
About 50.
50?
Yeah. Let me see if I can get anything else out of the stomach that I have. This is as serious a case as it can get. This is definitely life or death. Come on, boy. Let's get that out of here. Whoa, 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 whoa. Maybe not. Calm down. Okay. Coda is regurgitating and howling in pain and just in really, really bad shape. As veterinarians, we get out and we treat these animals, but it definitely tugs at our heartstring. I feel really bad for Coda. And then we're gonna probably go activated charcoal.
Yeah.
Tell Andrea I'm gonna need some activated charcoal.
Okay.
Activated charcoal is oftentimes used when we have an animal that has eaten some kind of toxin. It'll bind with the toxin, it makes it too large to get into the bloodstream, and it's passed through the digestive tract. So what's happening is he's got an aflatoxin. Basically the toxin off the mold. We're gonna get some Toxaban to kind of start trying to get rid of some of these toxins, but that's what's going on. We're gonna get him through it.
You're okay. Hey, my baby. You're okay.
All right, I'm gonna have you stand back. This stuff is nasty. I don't want to get all of your stuff in. So, I know it. Let's get more diazepam. You gotta have this for your own good, though, but we're gonna make you feel better. Okay, swallow. There you go. I know.
That was productive. You're all right, buddy.
His heart rate and all that stuff looks good.
Okay, thank you.
Usually takes about 24, 48 to hopefully get out of the system, so you can clean them up best you can, Drew.
Oh, goodness.
We're gonna make a huge padded cell. What I'm gonna do is line Coda's cage up with really thin blankets, just in case Coda sees again, and we can prevent Coda from hurting himself.
But he has a good prognosis. There should be a good outcome from this.
But I would think it's fair. I feel like you got a pretty good shot of it. You got to activate the charcoal. Monitor him, give him value throughout. Make sure that we keep these seizures down. But we just want to make sure these aflatoxins don't destroy the liver. That's the thing we got to worry about, the secondary destruction of the liver.
Okay. We're just going to pray for the best outcome possible. I'll be a nervous person until we hear for sure that he'll be out of the woods.
We'll watch him throughout, and we'll see how he does.
Okay. Okay. I appreciate you. My only grandchildren are my dogs.
Lucky the cat has an appointment for an unfortunate problem.
Hello, how are you doing today?
Good.
I am doing fantastic as well.
How's your baby?
What we got going on with this baby?
He's losing his hair. He's been having some issues with scratching and itching. Lucky got his name because there was, I guess, a litter of cats that gotten left up underneath the neighbor's house next door, which was vacant. And he was the only one that survived. So we just called him Lucky. He's been licking, scratching. I've been giving him a lot of that hairball remedy stuff. I don't know if it was stress from us moving.
Okay, so you just moved how long ago?
Maybe a month.
Okay, and the hair loss, it started after you moved, though?
It started happening while we were packing.
Hair loss can definitely develop from stress in a cat. It can be, several different reasons. Anything from external parasites can cause it, to different allergies can cause it, to all the way to some types of endocrine diseases. We're going to put that detective hat on and try to track this thing down. We'll rule out some things, we'll rule in some things, and see if we can come up with a definitive diagnosis. You see where this lesion, they start back here? It kind of starts at the base of the tail, and it kind of works itself up the back here. We call this lesion pathognomonic, okay? And what that means is, if you see this, you have this. Meaning, if I see this lesion right here, we're dealing with a flea allergy. We have what we call flea allergy dermatitis. One of the things we look for with hair loss is what we call a Christmas tree lesion, where we start to have hair loss that starts at the base of the tail, and the hair loss progresses up the back. This baby has that Christmas tree lesion, which leaves no doubt that we have what we call flea allergy dermatitis.
I didn't see any fleas.
Right. It doesn't take a lot of fleas. It's just 1 or 2 flea bites. They're allergic to the fleas, and it causes them to have this lesion. So we do a couple things. One is we're going to get something to help stop the itching, okay? And 2, we need to get on an antibiotic to help treat this area. Today, we're going to treat it symptomatically. We're going to treat itching. We're going to treat the secondary bacterial infection, as well as treat for the fleas that we have. We're going to treat with antibiotics, and we're going to get some meds to help stop these fleas. And over a period of time, the itching will stop, the hair will grow back, and this baby will be doing fine. Oh, that should take care for us. Okay?
Well, thank you.
Thank you.
I think Lucky's gonna get better. I'm hoping that he lives a long, happy life, and he's just like one of my children. You gonna come to me? Bet you if I was open, then she'd come over.
Are you a boy or are you a girl? Huh? Are you a girl? My name is Michelle. I'm a technician here at Critter Fixers. What are you? I brought my baby bearded. Today I want to know if he's a male or a female.
All right, tell me about this new baby, Michelle.
This is Sam, or Sam-E with an I-E.
Hey.
My husband bought him for me because I told him working here I have fallen in love.
I love with him. As we try to get away. Everybody at Critter Fixers, we're here because we love animals. Michelle is one of the newer members of the team, but she's just a joy to be around. So she's been really on me about sex in this bearded dragon. You can look for bulges in the right place, and when they get older, females have pores. We're looking at that, and males do not have the pores. So I'm looking for both. And I'll be right back.
What do you mean you'll be right back?
I'll be right back. It's been a really long week, but I always try to do something fun and entertaining for my staff. So I have a little bit of a surprise for Michelle. T, what you doing, man?
You having a baby? 2 babies.
Well, you know Michelle, she been walking around here. She got that new bearded dragon. I told her I would look at it and see exactly what it was.
All right,
go in here.
Let's go.
She has no clue.
Okay.
You got a gender reveal going on here.
Oh, that is adorable.
So we don't want to scare it.
No.
So when I pop the balloon, put them up. The verdict is...
Yeah. Hold on.
Is it a boy? Who said boy?
I said boy. I said boy. I think it's a boy.
Oh, man, y'all know everything.
So we take all the boys away. We take the boys away.
Veterinary medicine is really tough. I mean, it's a roller coaster. You know, it's very important to have these lighthearted, good, fun moments with the team.
Do you think he's healthy?
I think it's great. I think she's great. Congratulations on your girl.
Sammy with an eye.
With an eye. Completely surprised with the balloons and the and everybody watching. It's really, really awesome to have all my coworkers to do this gender reveal for me. It is super special.
And you can take the balloons.
Yay! I'm hoping that Sammy is gonna be a cuddler and not want to stay in the cage because I want to walk with her everywhere I go.
Congratulations, Mama.
Sammy, you are a girl. Sammy is a girl.
What's the little dance where they do this?
I have no idea what you're doing.
Am I on the cool hip guy around here?
All right, Coda. Let's see how you feeling.
It's been about 24 hours since Coda the dog was presented for seizuring and toxicosis. He's definitely doing a lot better. All right, Coda.
All right.
We're gonna grab some blood and we're gonna compare these liver levels to the levels we had yesterday. We're definitely better neurologically, but I'm still worried about his liver.
All right. Find new blood.
Yeah, boy. So our liver enzymes are definitely going up.
I don't know.
Aflatoxin, that's what they're doing. That's what I was worried about. Went from normal, starting to spike now.
Yeah.
Coda's liver enzymes are definitely elevated. This could still become fatal. The safest place for Coda is going to be in Hotel Hodges tonight because this is the real deal. I mean, most times when you hear about aflatoxins, it's too late. We were fortunate enough to catch it in time. And so, you know, we're just going to keep doing our thing and keep plugging at it. And I don't give up a fight either, so we're going to get through this.
Mm-hmm. All right, little buddy.
And that what you do when you snap your fingers?
Yeah. Oh, when you go to like poetry?
From Byron, Georgia. It's time to go to lunch because she's hungry.
It's okay. It's okay. I'm bringing Khaleesi. I've only had her for a little bit of time, but we've already built like such a bond.
Hey, how are you?
Good, how are
All right,
you?
good. Dr. Ferguson?
Nice to meet you.
All right, so what's going on with this baby?
She got attacked by a dog
Ooh.
last night.
Okay.
She got skinned.
But we definitely lucky. We normally don't see rats that are attacked by dogs because they don't make it.
Oh, yeah, especially her being so little.
Yeah, so she did a good job of getting away. You did strip this tail, almost like you strip wires. So the game plan is we're gonna have to amputate part of that tail.
Okay, I anticipated that.
Khaleesi had what we call a degloving injury where it basically stripped the skin off the tail.
Let me go get your cage.
Bring me that little rolling stool. Because there's no skin on the tail, there's no protection. And basically what it would do is it would become necrotic, and then that would possibly cause an infection, which could be detrimental to this rat.
Heart rate sounds good.
The skin forms a barrier. It helps not only keep bacteria and things out, it helps keep moisture in. And when you don't have that barrier, those things will start to dry up, which is what we have right there.
Might need to cut them down a little bit, Doc.
What I'm going to do is just go just a little bit above where our good tissue is. The cut.
All right.
So we're gonna put one stitch in there probably. All right, the amputation is done. Still looks pretty long and pretty decent, doesn't it? Mm-hmm. All right.
All right, buddy.
Got going, boss?
Slough some of the end of the tail. They got jumped on by a dog. I've seen dogs get worse by jumped on by a dog. So that's definitely a lucky rat. Yes. Rats normally use their tail for balance and navigating, but because we only removed 30% of the tail, it's not going to affect quality of life in any way. Good news is that everything went well.
Okay.
But I want to monitor this baby for throughout the rest of the day until in the morning, because we got to give anesthesia.
Okay.
And to be able to discharge tomorrow evening.
Okay.
Okay.
I'm gonna miss her. I'm hoping Khaleesi's staying overnight, that they can make sure that there's not anything else wrong. I want her to come home and be comfortable.
Everything else looks good, okay?
All right, thank you.
All right, yes, ma'am.
Tafty, I know you're mad. The vet's coming.
I got a turtle. You ever read Yertle the Turtle?
No.
What kind of school you went to?
Plain County Public School System.
Y'all read Yertle the Turtle? Dr. Seuss?
I know who Dr. Seuss is. I didn't read Yertle the Turtle. Might have been way before my time. What's wrong with the turtle?
A swollen neck. How you doing, man? You all right? All right, tell me about this tortoise.
He's sick.
He's sick. How long?
When I took him out to put him outside today, I noticed that his neck was puffy, and it wasn't as puffy as it is now. Taft, he's our so-called tortoise. His name is William H. Taft, after President Taft, because he's so large and chunky. That's why my son named him that. And looks like he's retaining fluid, so that's abnormal for him, and he's been just not himself. It is scary because he's my son's tortoise, and he doesn't have any other animals at the house, so he's very concerned about how Taft's well-being is today.
What's his normal diet?
Collard greens, ryegrass in the backyard. Just depends what we have.
Do you have, like, the little dandelions or little flowers in the yard?
Yeah.
Has he been eating those?
Yeah.
Sometimes that can mess up their stomach, you know.
And make him swollen like that?
This may be straining. I'm gonna kind of see, especially since it came up like that.
Okay, yeah.
I just want to see, make sure you ain't eating a rock.
We have rocks in by the garden, but he doesn't ever mess with them.
All right, I'm gonna check him out. I'll be right back, okay?
Right, thank you.
Looking at Taft, there's all kinds of things going on. I want to see if there's some kind of impaction inside the intestine.
Just keep him right there for me, or he's gonna try to run away.
And I'm just trying to figure everything out and put these pieces to the puzzles together.
Oh, man.
Go ahead and get the parents. He pretty packed up. He is constipated.
Yeah.
This is all poop. You can see the whole poop.
How do we get the poop
I
out
want
of
you
it?
to soak him and put him on some lactulose. See if we can move out some and stop your straining. But we got a lot
He's
to...
real impacted.
Yes.
Why is his neck swollen?
I think he's trying to strain. I mean, that's my thought. You know, I'll give you a list of fruit and stuff I do want you to kind of give him. Red and orange type things are the ones you want to feed. You got a great turtle. So I'm finna go work on him right now.
Okay.
Taft's bowels are so impacted. I'm gonna have to definitely remove this all manually. See this back in?
Mm-hmm.
See the stuff hanging out?
Mm-hmm.
Somebody gotta get it out of there.
Okay.
You open that up?
I'll do it. I'll learn how to do it.
To manipulate all of this poop out of Taft, I put this tortoise inside of a bunch of water so that we can kind of lubricate it. I also use mineral oil so that I can lubricate it, as well as a laxative. It's your first day.
It is.
No, I have not had a constipated turtle in 20 plus years of being here. Is this like a coincidence? If I get another constipated turtle tomorrow, we're gonna have a talk.
Well, would you rather have a constipated turtle or a constipated cat?
You're right. And the only thing that's left is actually use my finger to try to manipulate all this poop out. Can you give me a tail and stop? I know. Come on, push. Not just stuck.
He's very tense.
You know, I went to school a lot of years to be scooping poop out of a tortoise.
I know.
And this is stuck. Come on, bud. Ow. Hey, yeah.
There you go. If you got this plug out.
I don't know, yeah, more. I'm gonna push. Yeah, there you go. Help me out, push, come on.
He's really trying to move away too.
Let's just let him soak for a little while. Hard and sandy.
Hardness?
Hard and sandy, a lot of sand.
Well, we live in a pecan orchard, and there's like sandy dirt in the backyard.
He didn't eat as much during the winter like he normally does.
What is that?
Piece of plastic?
That ain't supposed to be in him. It's plastic.
Like the thing out of the underneath the garden.
So,
like the flower bed.
maybe that's...
Yeah. That's what clogged him up.
There's definitely more poop in there, but he can pass it. That's the biggest thing. If y'all give me a few months, I'll come back and get you. I just wanted to kind of keep y'all posted.
Thank you.
It appears that a bunch of plastic was causing Taft's blockage. I think we got most of that out. Now, it's just letting everything else naturally move its way out. So I think Taft is on his way to a full recovery. I got a lot, and I got a lot of plastic, but I'm pulling more plastic out. If I kept him overnight and kept trying to get this out manually and then send him home tomorrow, would he be okay with it?
Are you okay if Tap stays here tonight?
Yes. We'll do that, and I'll see you guys tomorrow.
I'm hoping for Taft just to get back to normal and be able to roam around our yard again. And my son has a very close relationship with Taft. It's his tortoise, his animal. He takes very good care of him. He feeds him every day, and he loves him dearly.
All right, I'll see you tomorrow.
Thank you for your help.
All right.
Thank you, babe.
How you doing?
Good, how's it going?
Bring your baby back.
All right, awesome.
All right, so everything went well.
My girlfriend, Rebecca, dropped off Khaleesi. I came to pick her up, and we're really looking forward to having her back home with us.
You saw the injury initially?
Yes.
Yeah, you saw where we call it degloving, where basically the skin was gone there. We didn't have to remove a lot, a couple of inches of the tail, so it still looks pretty okay. You know, just a little bit shorter tail there, but we got medicine going home with you, okay? And everything's good, so I want to see the baby back in a week. Pay close attention and make sure that we're not chewing. I know it's going to be hard. The tail start itching and irritating and may want to chew on it, and we definitely need to discourage it.
Okay.
Okay? All right, thank you, sir. All right, there's your man.
Appreciate you.
Don't forget to refrigerate, okay?
Bringing Khaleesi home without half a tail, it's going to be kind of funny to see if she walks a little differently or anything, but I'm sure she's going to be excited to be back and getting treats from us again. Hey, girl.
Hey, what's the latest on Coda? Coda's been here for a while now.
Man, a long time. That was touch and go. Come on, boy. Let's get that out of here. Whoa, 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 whoa. Maybe not.
Well, I get all that. But are you going to let me know how Coda's doing?
Man, Coda's owner is just having to be in consult. Stay tuned, buddy.
All right.
Of course, Coda comes in without me, but you got the leash. Coda's doing good, huh? You just left the leash. You feeling a whole lot better.
From what I heard from when my mom brought him in, he is a completely different dog.
Coda's seizures have stopped. The liver enzymes are back to a normal level. So I'm really glad that Coda is leaving Hotel Hodges and headed home with the owners. But this is definitely something to think about with your dogs, because they will eat anything. Make sure you double bag that trash. The ALT, which was 124, we've come down to 97, so we've come down. So the only thing we gotta do now is give some liver medicine for me, and then I'm probably gonna just check their blood parameter probably in about 2 weeks, but
Okay.
other than that, just their mold stuff.
You think he's good? Thank you so much for all of your help.
I know, right?
My mom and I love my dog. I got him when I was in the middle of high school going through something really tough. So I'm excited to get him back into his routine and just get him happy again. So I'm excited to take him home. You ready to go home?
Hey, come here, Thunder. Get over here. Sit down.
Thunder returns to the clinic with hopes for a positive prognosis.
Good morning. So y'all didn't see me, I'm gonna slip on by you. That's right. So how are you today? You doing good? Oh, doing good, doing good. Good to see you. All right. So how the baby been doing?
He's good, but he's scratched it.
You scratched it a little bit? Yep, got it open a little bit. But it's okay.
I brought Thunder back. He had a growth on his chest that was removed.
So we'll get this growth prepared and sent in to the pathologist once we get a report back. Hopefully the report is clean.
And hopefully be able to find out if the tumor was actually cancerous. No one wants to hear the C word, so I'm hoping that everything's gonna be okay.
All right, so we got your report back. The bad news is it is a cancerous growth. It's what we call squamous cell carcinoma. And it's one of these tumors that is usually isolated in the skin or the cutaneous area. But the good news is it's the type of cancer that usually does not move. It does not metastasize, does not go to the lymph nodes or go to the liver or the lungs. And that's when we get concerned, because those are the times that they can be detrimental.
Okay.
No one wants to hear their dog has cancer. But if we did have a type of cancer, this is the type you want to have, because it's a type of cancer that's locally invasive, which means that it doesn't metastasize or move to other areas. We still need to monitor, but probably once a year we will do survey x-rays to be sure that we're not getting anything in the liver. Another week it should be healed up and looking good.
You want me to leave the cone on him?
Yes, ma'am. Just leave it on a little longer.
Okay, you can tell he's beat
He's
that
been working on it though, hasn't he? I think it's going the wrong way, isn't it, man?
He's figured out how to do that.
You making a skirt out this thing. Yeah, but he's doing good and feeling good, so we'll probably see him here in about 12 months.
Thank you very much.
All right, no problem.
I'm really glad that we didn't get the type of cancer that would metastasize inside of his body. Dr. Ferguson just has a way of helping you stay calm and to reassure you that we are doing the right things. He doesn't really sugarcoat things, which I really appreciate. It's really nice that he cares so genuinely about you as a person and also your pet.
All right.
Thank you very much.
Yeah, all right, see you later.
Okay.
Have a good one.
You too. Come on, buddy, this way.
Woo, boy. Bird, you have taken some years off my life.
Dr. Hodges checks on Ray the cockatiel after ruptured egg removal surgery.
Hey. Wow.
Look at that.
Your new name is gonna be Miracle.
Miracle?
Yeah, I know. The incision site looks good.
He said, don't touch it, as long as you don't touch it.
Ray had a egg inside that wouldn't come out. I mean, it was really, really thin. We're just gonna change Ray's diet a little bit. Yesterday was really touch and go, but I think the owner's gonna be really happy. Come on, Ray. Ray is out of here.
Oh my gosh, are you serious? Oh, wow. I thought she was gonna be debilitated and sleepy and not feel good. She looks normal.
I mean, when you walked in the room and you looked at the owner and all of a sudden her eyes almost popped out of her head because she was just so surprised. It's just the most amazing feeling because I wasn't so sure if it was gonna be a success. I just knew I was gonna give it my best. And I mean, just seeing her reaction made it all worth it. What'd you think?
Look at her. She looks brand new. She's looking at you.
I'm stunned. I'm stunned. I can't. What? Are you kidding me?
All I can say is, wow. Red's going home. That was a tough case. Oftentimes, we're dealing with life and death, and sometimes it just hits you, you know? I mean, you literally feeling this bird's heartbeat as you're working. You know, sometimes it can be overwhelming.
You did good.
I appreciate it. Removing a broken egg from the oviduct of a small bird is not easy. This time it worked out, so I'm just super happy for that miracle that Ray's family was looking for. It was pretty bad. So the yolk and everything, we had to flush everything out. It was a broken egg because it was so paper thin. I mean, it was like paper thin.
Yeah.
Just didn't have enough calcium, but you guys got to do something for me. We got some antibiotics and pain medicine.
I'm just totally in shock. My heart is just jumping out of my chest. I'm super happy just to see her. I mean, it was like magic. Like he waved the magic wand and she was just her old self again.
This is the pain. You give it in the evening.
Okay. Give it in the evening?
Yes.
We want to do more calcium and make sure we get some calcium so that we can get those bones remodeled.
Oh my gosh, yeah, I know. I love you. Oh my gosh, I love you guys. You guys are my heroes. I just felt like a storm came and it went, and I got the sunshine going, and I got my bird back, and she is top notch, and I can't wait to take her home.
Well, good luck.
Okay, thank you so
See
much.
y'all later.
Okay.
All right, appreciate it.
I miss you so much. Oh my gosh. Oh, my baby bird.
Listen, Joy, what's worse than one more abnormal growth?
A pack of them.
2 more.
Oh, I like my answer better. All right, do it one more time.
2 more.
Oh, 2 more. Oh, like a tumor.
Oh, you didn't get it?
I didn't get it. I thought you meant like 2, yeah, like 2 more, like multiple.
2 more.
Oh, okay, good. Well,
Maybe
that's
they'll
a
do-
good joke.
Okay.
That was a good one. You got me.
It took a little while. You put that thing in deep freeze and brought it out there. You did good.
I made a C. C's get degrees.
C's get degrees, that's right.
All right, I need mine.
You're a graduate of Critter Fixer University. That's all we need to
Gosh, I'm an A student in that.
know. That's right.
Sushi. Oh my goodness. Where did he go?
Sushi and Goose the kittens arrive at Critter Fixer for their very first wellness exam.
They never stop moving. I'm bringing in Goose and Sushi today to get them checked for worms, make sure they're nice and healthy before I bring them around my other cats. Sushi is probably the naughtiest kitten I've ever seen. He's constantly getting into stuff, Goose is scared of everything, and they're just complete opposites, but they are hilarious together.
Hey.
Hello.
First of all, the names.
Oh, my
Let's start there.
Okay.
So cute.
I take it you like sushi?
Yes, I do like sushi.
Okay. They are all over the place, huh?
Yes, they are.
Hey.
One's Goose.
Goose.
Yep.
Okay, duck, Goose. Okay.
All right, let's hear Goose out first. How are we eating?
They're both doing really good. They don't stop.
There are no friends in those ears. Where these babies come from?
We found them in a field by their mom. She wasn't alive.
Pretty lucky, huh? Y'all survivors. All right, Sushi. Let's see what's going on here. Now, the ears look good. Okay, we're gonna get some stool samples from these kitties. Hang tight. My initial exam of these two kittens showed strong heartbeats and nice clean ears. But I need to get a grasp on what's going on internally, so we're gonna get a stool sample. Parasites are quite common in young patients. These parasites take away all the nutrients, as well as suck their blood and make them quite anemic. And you definitely don't want that.
They are the cutest little kittens I have ever seen. They're a little busy, though.
Man, you gotta stay still, buddy.
You're so young to be so bad.
Get off me.
Stay in there. You're doing a good job.
Gotta let me in, buddy.
All right, I'm gonna go give y'all back to y'all mama. Mom, they are a handful. I mean, like, this one looks like he may be a Mancoon.
That's what we were thinking, too.
So you know that can get really, really big.
Yes.
You know what? We have a Mancoon here in the office. You should check out our office cat. This is Bear.
He's huge.
He is huge. I love him.
How old is he?
He's about 6. I love him this big. All right, I just had to show you off my big kitten. I know.
It was hilarious because it almost made Bear look even bigger seeing him next to Goose and Sushi. They are so tiny. I hope Sushi doesn't get to be that big, but I definitely think Goose is going to be. He's already huge, and he has huge paws.
All righty. So we didn't find any of the larvae in the stool, which is good, but they're young, so the worms could be not shedding eggs yet.
Okay.
So we're gonna deworm. Come on out here. Now, it's gonna taste pretty good. What you think about that?
Good.
All right. Hey, what you think? Tastes pretty good? You're like, I want more. They are good to go.
Awesome. Now that I know that the kittens are nice and healthy, I'm excited to finally introduce them to my other 2 cats and see how they get along and watch them all grow up together.
All right. I will see you in a week and a half.
Okay.
And we'll do a shot. All right, Goose and Sushi.
Thank you.
All right, Mom. See you in a few weeks,
See
okay?
you later.
Those some cute kids you got to treat there.
Yeah, but we had a little bit of a tricky situation during that appointment.
Oh, yeah?
Andrea brought in Bear, our office cat.
And that's a problem?
Yeah, I mean, he's kind of getting off the wrong impression, don't you think?
Mancoons are supposed to be big.
Not that big.
Why, you think people don't think we practice what we preach?
Yeah, how they gonna take our recommendations on nutrition seriously if the diet we put Bear on ain't working?
Bear's on a diet?
Yes. And look at Bear's food bowl. I walked by and I was like, does Bear look like he need all that food? Who feeding Bear this?
Sure wasn't me.
Polly. Mm-hmm. Come look at this. Oh, boy.
That's a lot of food.
Especially when I put him on a strict diet. Our Bear need to be on a diet.
Don't tell me that.
His food was this high.
That is way too much. But he actually did lose some weight. He was bigger. He was like 18. He's like 16 pounds now.
Well, let's keep him at least going trending in the right direction.
Yeah.
If I can't limit his calories, I'm gonna have to get him to burn some calories. You gonna explore outside? Hey, Bear, get you some exercise. Look at that belly. That didn't work for a second. At least we get him some running.
Yeah, his foot hurts, so let's not touch it, okay? But you can touch his back.
Hey, guys.
Hey.
Hey, you fine right there. How you doing?
Hello. Well, you're not
You
a
doing
rabbit.
okay? What's your name?
Shepherd.
Shepherd. I like that name.
This is Grandpa.
All right.
Handsome.
So tell me about Grandpa.
George hit him and hurt his leg.
Hurt his leg?
Yes.
All right, let me see if I can make him better.
We're bringing in our Flemish giant rabbit, Grandpa, because we think he broke his leg. It has been sad to see him not as active as he usually is. Grandpa became Grandpa because even though he's only 6 months old, he is very huge. And he's just very mellow and calm, and he just reminded us of a grandpa.
So we're gonna start down here. I just wanna see how Grandpa moves a little bit.
Okay.
Don't let him out of here now.
I won't. I'm gonna keep a watch out on him. Oh, so it's the back left.
Yeah.
She's carrying it. Man, I can see a little bit on that back left. Let's
And
see
it
what we
seems
got.
a little puppier than the other one.
So we were jumping in and out of the cage.
They were playing with the rabbit outside yesterday and put him in the rabbit hut.
Okay.
And when he was trying to get out, his foot got caught on the bottom grate and his body did not.
That makes sense.
So it went over.
So I'm gonna go back and manipulate him a little bit and shoot a picture just to kind of see if I can find any fracture or anything there. Give me 1 second.
Okay.
I'll be back, Shepherd.
Okay, okie dokie.
Whew, boy, you got 2 hurt legs, huh? Fortunately not broken, though. You hurt, huh, buddy? Go get Mom for me.
I will.
I was really worried about a possible broken leg, but, you know, fortunately I didn't see any breaks, just a whole lot of bruising and a lot of swelling and inflammation. Recovery will take Grandpa a little bit of time. You know, I think we definitely dodged the bullet. You can see his bones, and the good news is no breaks.
Okay, okay.
But now look at this side. You see how swollen it is?
Yes.
It's almost twice the size. So we're gonna do a little laser therapy on him, and we're gonna get you some pain medicine. I think you're gonna be fine.
Okay.
Get our bunny back.
Yes, you're gonna get your bunny
You'll
back.
get it back. The big thing is, I ain't gonna want cage rest probably for the next 5-7 days.
Okay.
All right? We're gonna give Grandpa a few laser therapy treatments. The way the laser works is it emits a certain wavelength of light that promotes healing. It brings oxygen to the surface, and it also decreases the amount of pain. So I think after a few treatments, Grandpa will be hopping around in no time. Shepherd, got some medicine here
Where's Grandpa?
for Grandpa.
All right, Hansel, can you come up for just a little bit?
Game is medicine, okay? You gonna watch?
Just go on the side here. You don't even have to open the mouth.
Okay.
So this won't hurt.
Choke him.
I promise we won't. I just put it in and I just squirt.
Okay.
Well, yum yum.
This is easy enough.
All right, buddy. You go back to all your treats. There you go.
I'm definitely glad we got it looked at and that he has pain medicines. Dr. Hodges was great. He was great with my son and very patient with Grandpa and took great care of him. And we love him. We'll definitely come back. All right, Grampies. All right, hold on, Shep.
Grandpa just, he's caught on my shirt.
Has an affinity for green.
I see that. Andrea, will you help me?
T.
What's up?
One of them days, bro. I might need to tag in.
Let's knock it out.
This is Chloe, and her owner's been noticing vaginal discharge. He sent me the pictures last night, and it was a pus.
Pregnant or pyometra?
I think
You're not sure. Okay. The best way to determine if we have a case of pyometra is to perform an ultrasound. And basically what we're looking for is the uterus to be fluid-filled, which indicates it's more than likely pus, and we have an infection. My ultrasound specialist over here. Hey, Harden, I need you to see if you see this uterus enlarged or anything. I'm really hoping it's not pyometra, because pyometra is something that's very serious and it can be fatal.
I'm gonna have to hold you and restrain you, buddy. I'm sorry. Well, what's that little? You see a little black spot on there?
You can't see the uterus.
You'll be white.
Yeah, you won't be able to see it at all.
Don't start moving again, man.
What is that?
Zoe. Oh, gosh.
How y'all?
All right.
Good, how you doing?
All right. What's going on with this baby?
Not doing normal, so doing a lot of urinating.
Okay, let's check her out.
Come on, Miss Zoe. When she picked her up, she was squealed.
Okay.
We brought in our dog today because she's been using the bathroom a lot pretty frequently and hasn't been finishing her meals lately. So we're a little worried today about that.
She's 11 now, so hoping it's just something that they can give her a little medication for and help her out.
How's her appetite?
She does not eat her whole full bowl.
Okay. Hey, what's going on? I definitely feel something y'all might not be old enough to remember. Y'all remember a hacky sack? Y'all remember
Yes.
that? Now, let me go take a picture. I'll be right back.
Okay, thank you.
Just on my physical exam, I can feel what I refer to as a hacky sack, almost like a bladder that's filled with rocks. I'm gonna have Paul go ahead and take an x-ray of this bladder and see exactly what's going on.
What we got here, Paul?
Doc said he felt something in her bladder. He said it felt like a hacking sack.
What is that?
Hacking sack? You know, the people kick the ball in like a circle? And you keep kicking it?
Soccer?
No, hacking sack.
Hack and sack.
Culture, man.
Get some culture.
Oh, man.
I ain't supposed to be there.
We can get Dr. Hodges so he can look at this.
Okay. Right, Doc, so we got x-rays.
You got anything on there?
It's a lot on there, Dr. Hodges.
Go get the family. Oh, boy.
Uh-oh.
All right, guys. This is the whole X-ray.
Okay.
Head, tail. This is the bladder.
Okay.
And this is the bladder filled with crystals and stones. This should be clear.
Okay.
Looking at this bladder, it definitely explains why Zoe wasn't acting quite normal. I can't believe this dog has room to pee.
Oh, wow. That's kind of scary.
This is a go to surgery this morning case.
All right.
What are you doing?
You. Appreciate it.
Appreciate
Thank you
you,
so
Doc.
much.
All right.
Thank you.
I'm just hoping this bladder isn't beat up really, really bad. If you can imagine having a balloon with a bunch of rocks in it and it just scratching the whole inside, I think it may be at least 100 stones in here. This is bad. This is hook this dog up to fluids, get this dog on the surgery table right now bad. Andrea, it ain't always a lot of firsts around here, but this might be the first time I had that many stones.
I think so too, Doc. Especially a small dog like this.
Yeah, even a big dog. I can't even remember my bladders like that. We made our skin incision, go in here in the abdomen, and see exactly what we got in this bladder. Whoa.
Big Hackensack ball.
Yes, truly.
But you know what's strange? She never showed like any discomfort.
Yeah. All right, let's see what we got here. Here they come.
Look, you got some river rocks.
That's crazy right there.
So you're a fisherman of stones?
Yes, well, yeah, for sure. When I make my initial incision into this bladder, wow, dozens of stones just start flowing out. A lot of stones. This is not the norm, man. I've done this a lot of times, but never like this.
How is it even possible to have this many stones?
Through a really bad urinary tract infection and really concentrated urine. These bladder stones form when the urine's pH gets too low, and these struvite and these crystals come together, and you get these stone formations. Just want to keep the tissues around it moist. All right, so we got our bladder back.
300 plus bladder stones.
Right, 10 agree with you, brother. And when I finish, hopefully, it'll look like nothing's happened. My plan is to keep Zoe overnight so that we can monitor. I'll start some IV fluids as well as control Zoe's pain. We'll start some antibiotics, and we'll start Zoe on the urinary-specific food that helps keep bladder stones from forming.
All right, buddy. So far, so good.
So it's got a normal temperature, normal white blood cell count, but it got a little discharge right there.
That's the bladder. That's the uterus here. It's thickened.
Dr. Hodges asked me for my help, so now I'm asking Dr. Horton for her help on this ultrasound. She's kind of our in-house ultrasound guru, so I want her to take a look at this, kind of shed a little light on this case. All that said, do I have any pus in there? That's what I need to know.
I don't see anything.
Good job, Doc.
But you do have some inflammation of the body of the uterus.
So I don't think the dog had pyometra. I think she has vaginitis. Basically, what we have is what we call vaginitis, which is an infection in the vaginal area. A lot of this breeder dog can get it because of how that vulva is kind of tucked up under there, and they can develop a little bacteria and discharge. In this case, it was best case scenario because basically get on some antibiotics, and everything should be fine. How's it going, buddy? All right. I just passed this thing on. He was about that busy, so I'm gonna go over some of this stuff with you. Okay. We ran some tests trying to determine if this is pyometra. We did an ultrasound. We still didn't see anything in there. How much discharge have you been seeing?
Just a little bit.
Okay.
That was just yesterday.
Okay, got you. I don't think she has pyometra. I think she has vaginitis.
Okay.
I'm gonna put on some antibiotics, and I'm also gonna get some of that I want you to flush her vaginal area to get that pH back where it needs to be. All right, buddy, we'll be right back. I'm gonna get some meds for you.
Thank you. Love Critter Fixers. Great doctors. My kids, they're gonna be very happy. She will get lots of love.
All right, so I'll help you walk her out.
Thank you.
This is a good yum-yum. Sound like a winner to me.
You gonna count all these?
Yeah, but I'm gonna try to use the pill counter app first.
Oh.
That's a whole lot of work, though.
It is. It is a whole lot of work. I'm gonna count them by hand just to be sure.
It's a lot of stones.
I'm thinking about 99. What you said?
200.
I was at 89. We should put up like a little betting. How about lunch?
Hold on. They don't. Whoever count them, I just pay them.
No.
Counting gonna be harder than surgery. Okay, all right.
Okay. Oh, no!
You're a good girl. I think you're losing some of your feathers, though. Hi there.
Hello, ma'am. Who we got here today? What's the baby name?
No name.
It's time. We gotta get a name now. Jordan is the chicken expert here, so we're gonna let her name this baby.
I wouldn't say expert, Doc.
So what you think name here?
I don't know. Let's see how sweet you are. Hi.
I got a name.
What is it?
cookies and cream.
Okay. Baby does look a little bit like cookies and cream. So what's going on?
I've been out of town for a few days, and when I came back, I thought she looked a lot thinner.
Okay.
She's not laying.
Okay. And she was laying one a day? She was? Okay.
My chicken is acting lethargic. She's losing feathers. She's very sweet, and I've really grown attached to her. I feel concerned because I also have 4 other chickens, and if there's something that this chicken has that could pass to my other chickens, I don't want to lose them.
Now, how many do you have total?
5.
5. Everybody else is doing okay?
Yes,
Okay.
everybody's laying. And I noticed there's some white feathers in the pen.
Okay. We are eating and drinking?
Mm-hmm. Definitely.
First thing, we kind of look here and make sure that, like, mites and things like that, they can get it. It'll make them a little bit lethargic, and sometimes we can physically see them here. We are a little thin down here on this breast. You're doing good. We're going to start with an x-ray, though.
Thank you.
We may even have to take some blood, depending on what we see on this x-ray, just to be sure that, you know, everything's going well. All right, we'll be right back.
It's okay.
Baby looks okay. You know, we do look a little bit lethargic, but the good thing is the owner said the baby is eating and drinking. We're a little bit thinner than I'd like to be, so we want to take some x-rays because a couple things on the list that we want to rule out, like Merck disease and things like that these guys can get, and hopefully it's not that because those are some things that are fatal. All right.
Come on in.
Okay. All right. Well, that's kind of plain as day unless you drew a circle on my x-ray. That's definitely an egg.
That's a big egg.
Yeah, that's a big egg.
Oh, wow.
All right, Mom, come on, let's look at the x-ray here.
Okay.
All right. So we got a present down there, probably not hard to see.
Oh, my
It's a big egg in there.
goodness. I
Yeah.
was right. Something is wrong.
When these chickens come in and they're egg-bound, it's very serious because it kind of blocks up everything else, and the longer the egg stays in there, the more potential that this chicken has of becoming infected. And we know if we become infected and get septicemia, then we're not going to have a good outcome. So we have to get that egg out of there. Okay, so what we do is we try to put enough lube in there and try to physically manipulate that egg out. The issue that can be, we don't want that egg to crack, because if it cracked, then we're going to be in trouble. You can see how thin it is right there. There's not a whole lot of calcium buildup on that egg, so we're going to keep our fingers crossed. But what we're going to do is get some anesthesia to relax the baby.
Okay.
So that we're not kind of pushing back, and hopefully it'll relax those muscles, and we can get this thing out. So fingers crossed at this point, kind of touch and go. It's a serious situation that we're in here, okay?
Thank you.
All right.
Thank you.
Mm-hmm.
Animals take your heart and they just grab a hold, and sometimes you don't think that would happen. I certainly didn't think we would get so attached to these chickens, but they're so sweet. I'm just glad I brought her, and I'm just gonna pray for her and hope that she'll have the best outcome possible.
Stop. I changed my plan. I don't want to do this first.
Wow.
Huh? Because I want to see if she can get it out. We're going to hydrate her.
Mm-hmm.
If we got a little calcium injection we'll give, we're going to put her in a little dark area, see if she pans it. Because that's our last ditch as we try to get this thing out. Because
you can risk breaking
Because
it.
if it break, yeah, she's gone.
Okay, so we're still sub-Q fluids.
Yep. And we're going to still do our lube.
Okay.
And let's see what happens. Give her about an hour or so. And if that don't work, then we left with no choice there.
Okay.
Hey.
Hey.
How you doing? All right, I'm changing plans.
Okay.
So what I'm gonna do initially is we're gonna get some fluid sub-Q to try to hydrate. We're gonna get some calcium because sometimes the calcium level can be low. The muscles need calcium for that contraction. It'd be a lot better if she can get this egg out herself.
I understand.
All right, so that's what we're gonna do. All
So
right.
do you want me to leave for a while?
You
or-
can, and then we'll give you a call if this didn't work and we need to go to the surgery part.
Thank you
All
so
right.
much, Dr. Ferguson.
We'll do what we can,
Thank
okay?
you.
Yeah, we'll try to get this baby back, okay?
Okay,
All
thank
right.
you so much.
Bear has not lost no weight. After my telling them not to feed Bear treats. Who is giving...
Andrea Wallace.
And then look at his head. So you know what he's on. He like mesmerized by treats.
Yeah.
Oh, no, Bear. That's the only way we can get you to exercise. I love Bear. But I'm gonna be the vet with the fattest cat in town. Bear.
Hey.
No, Bear.
How's it going, Doc?
You don't even try to hide it. It's on the cage.
Because somebody, like, hid it from me. Look at it. You can make him do a dance.
Yeah, I know, right? I'll believe it. That's okay. All right,
Man, look at him. He like, what my treats at?
The anticipation is over. Time to get down and make it happen.
Back up, good girl. You'll be back out in a minute, okay?
A parrot flies in with an identity crisis.
Good, Pepper. Come on. My girlfriend absolutely loves birds. She's always wanted a bird. And we saw this green-cheeked conure that looked like one I had many years ago. When we bought her a couple weeks ago, we didn't know if she was a male or female, so we came to find out.
Hey, hey, hey.
Hi.
How you doing?
I'm doing all right.
What we got here today?
We got Pepper.
Oh, it's beautiful.
That she is.
Yeah, still just a baby.
Yep.
How we been doing?
Been doing good. Where we got her, didn't know whether it was a male or a female, so just kind of want to get that figured out.
All right. Now, you know, a lot of time in these birds, some birds, you can kind of tell by what the feathers look like and determine if they're male or female. But unfortunately, this one we can't.
Yeah.
So what we'll have to do is do a DNA test. Just get a little blood, just treat no nails, and we send that in, and then they'll sex the bird.
Okay.
Okay? All right, we're going to get the baby in the back. Get a little blood here, okay?
Okay.
We're going to take this, okay?
Okay.
The least invasive way to draw blood from a small bird is to actually trim the tip of the nail and just hit the tip of the quick, which is basically a vessel that's inside the nail. Get a few drops of blood, and we put it on a special card. And this card gets sent off to the lab, and they'll send us results back. Well, let's see which one we're going to work with.
Her claws are fairly sharp.
Why are you scared me? I didn't touch you. Don't scare me like that. There we go. There we go. Okay. I think we got enough drill. Pepper, that wasn't too bad, was it? All right, so we go back and show where we are and what we have here. Huh?
All right.
All right. So I'm gonna show you this little card. We prick just trim one of the little nails there.
Okay.
And we got a little blood there.
Okay.
And that should suffice. It doesn't seem like a lot, but they only need a drop on that to do a test. So we'll get this filled out and get off to the lab. So probably within a week or two, we'll have results. Everything else looks good except, you know, drill ruffled the baby feather. We're mad now. She gonna go tell mommy on us.
Yeah, I appreciate it.
All right, you have a good one now.
You too.
All right.
There you go.
Thank you very much. Honestly, it doesn't matter whether it's a boy or a girl. It's just more out of curiosity. It's okay, Pepper.
I got a code blue.
What's wrong? What's wrong?
There's a code blue.
All right, she got.
What do you need me to do?
She got coming out here?
Outside, he got into something they don't know.
Looks like blood in the stool. Let's put an IV catheter in and let's start those fluids. Give me a temp. Come on.
106.1.
All right.
I wonder if he's outside.
Yep.
He was outside.
Man, it's hot. It's hot. No, give me like some cold water. Get some ice packs and a wet towel.
Hold the hand right here.
We got to bring that body temperature down now.
All right, baby. Normal dog temperature is 100.5 to 102.5. When it starts getting up in the 105 range, we're in dangerous territory.
At 106.6.
What is it?
106.6.
We don't get this temperature under control, he's gonna overheat and he's gonna die. Hold on.
Oh, sorry. Come on, man.
Give me the owner in here.
He doesn't know.
Bring the owner.
There you go. Good boy.
Were we outside?
Yes, we was outside grilling. He went on the trampoline. Next thing you know, Mom sprayed some stuff out there.
What's the stuff?
Stuff to kill plants out there.
Okay, how long? Like today?
Today.
From talking to the owner, it sounded like Max possibly could have ate some weed killer.
You're all right, baby. I know.
Oh, man.
He's still alert, so that's a good sign. We heading in the right direction yet?
105.5.
All right, 105.5 is going down. Let's just stay where we at right here. He's hot, so they want to cool down, so that's why he's drinking a lot of water. We're probably gonna stop it in a minute because I don't want to drink all this water and regurgitate either. The temp is coming down. We started at like 106.8, I think the highest it got is at 105.5 now. So we're heading in the right direction. Once we get to a certain point, we want to, pull this ice off because we don't want it to go too low and be hypothermic.
Here's your atropine.
Could be primary heat. I don't know yet.
You want any Toxaban?
Yeah, let's go ahead and get some
How much you
activated
think he
charcoal in
weighs?
there.
40, 45?
No, he's about 60 pounds, I think. We gave some atropine initially, which is what you can give for organophosphate toxicity, which is some of those things that they get. Also, we're going to give some activated charcoal just in case there's still some in that GI tract or stomach. It'll actually help pick it up and absorb it so the body doesn't metabolize it. All right, we're going to hold off on the water for you for a minute, buddy.
104.6.
It's okay. I'm right here with you.
You're a good boy.
I'm right here with you. All right, so temperature is going down. Okay. We started out like at 106.8, I think it was. We got blood drawn. So we're gonna run some tests to make sure organ functions are fine, liver, kidney, and those things. And I'm doing a check for pancreatitis because to be sure that wasn't initially what started us the diarrhea, and just being outside in the heat caused us to be overheated. So we're trying to cover all spectrums here, but we are at this point getting a little bit more stable, okay? So we're not out the woods yet, but we're heading in the right direction. I'm gonna let you visit with him before you head out, and then we got some tests, and I'll call you back on those.
If they can get him back to normal max, playing around, jumping around, that'd be awesome.
You're gonna be okay, okay? You just got sick. You gotta stop chewing stuff. But now, when you come back home, we're gonna stay in the house all day, okay? Me and you, sleeping all day.
Very happy that he's in their hands. I didn't know he's a little wild little pet, but hey, he's strong. I feel like he's a strong believer. He'll stay strong for me, though, and my family, too.
Every 5 minutes, give me a temp check, okay?
Every 5 minutes. Okay.
Bring him over here. Barry's gonna have to lose some weight.
He is big boned.
Barry ain't big boned. Barry is big, too big.
They talking about your weight, Bear.
That gotta go.
Good girl, she did it.
It's that lube that we gave.
Look. She's so happy with herself. Look, she laid it naturally.
Today must be my lucky day. You know, I'm kind of stressing out over cookies and cream that has this egg-bound egg. But luckily, after giving fluids, I see an egg. We don't have to do any surgery. This baby did it all on her own.
Hey.
All right.
She survived.
We have an egg.
Oh, my gosh. Oh, my gosh.
And she did it on her own.
She did? Hey, sweetie.
And she even a little bit more perkier. And she's a lot more vocal.
Yeah.
Right.
She is perkier, for sure.
I'm so glad.
So she's feeling better.
Was there anything I did that made
No, ma'am.
this happen?
No, it happened. Don't take off
She's
here.
about to go down. She can jump.
Oh, you gonna let? Oh, you want to put it down?
She wants to go down.
Okay, we'll go down. There we go. Go to Jordan and jump on her. Pick her. Okay, I'm going over here. All right. So, and when I looked at some of this stuff that I saw in the egg when I came out, gave an indication that it possibly could be some infection there. That's why we're going on antibiotics, okay?
Okay.
And also we're going on some medicine for pain. And make sure we're eating, make sure we're drinking, and that should be fine. All right?
Thank you so
Okay.
much. I'm
All right.
so relieved.
But I'm glad everything worked out.
Oh, me too.
Yes, ma'am.
Thank
All
you
right.
so much.
Okay.
I'm thrilled that she's okay. I was just bracing myself on the way over here thinking, I'm just gonna be taking an empty crate home, so glad it worked out. Okay, I'm so relieved.
How's he doing, Jordan?
Great. Doing well, better.
He looks a little better.
Yeah, better than when he came in.
Dr. Silva.
Yes.
Got a special surprise for you.
Okay.
We're gonna let you come in and see a rat.
A rat?
A rat.
These are surely the critter fixers.
This is Dr. Silva's second week, and she is doing absolutely amazing at Critter Fixer. Our new vets, I try to get in and kind of show them hands-on. You know, in vet school, they don't really teach you a lot about rats, and most people may not even want to know a lot about rats. Morning.
Morning.
How are you?
I'm good.
All right, so what's that rat's name?
Daisy.
Daisy. So how long have you had Daisy?
She's 2.5.
Give me a little rundown of what's going on, what we're kind of doing.
She's not eating, not drinking, very lethargic, wobbly.
Okay. Hey, Daisy.
Daisy's very playful, very loving. So she started getting all lethargic. I knew Daisy wasn't okay. It makes me sad thinking about it.
So, Doc, first we want to see how we kind of move around.
Okay. Then we're moving in a pretty tight circle.
Yeah, mostly to our left side.
Yeah.
If it was a dog, what you be thinking?
I'll be thinking about vestibular disease.
Yep, inner ear is definitely one thing. All right, Zane, go get my weight and tell. Equilibrium is off. I'm worried about something called vestibular disease, which really would be a best case scenario because oftentimes we can treat an ear infection with antibiotics. If it's a pituitary tumor, unfortunately, that's kind of going to be a worst case scenario. And unfortunately, it probably would be a death sentence.
Please don't let it be a tumor.
Come on over. All right, so this is the head tail. I'm gonna blow this up. I want you to look at this and this, okay? Do they look the same size?
No.
There's a lot of infection and inflammation in here, but there's no tumor. It's an ear infection. So we just gotta get some antibiotics there.
Oh my gosh, that's a relief. Oh my gosh. I was so worried about her.
Good job. Now you come over here.
Okay.
Now that I've put my client at ease, it's time to give Dr. Silver one final test. All right, what's going on? What you see?
I see both our tympanic bullets they're intact.
Yes.
Here.
Yes. Look at the bullet. Look at them hard.
Right side's inflamed. Looks like she has an ear infection. Okay, I got an elbow. I got some.
Stuff on. Good job. Give me 1 second. Let me get some antibiotics for you.
Okay.
I never try to be too busy for my doctors. I always try to bring them over and bring them in on cases. Or if they have a case, I always try to jump in to help them. Candace did amazing. She's a great doctor. Today was a good day. All righty. Got your medicine flavored? What flavor we use?
Banana nut bread.
All right. We use banana nut bread?
My rat likes to eat it at home.
All right, come around, Mom. So we want to see how we like this. What you think? Oh, yeah. Say, maybe you was right.
Well, she is enjoying it.
You're gonna give this antibiotics, you're gonna give this pain medicine, and hopefully we start feeling better.
Well, I hope so. Look at her. That's the fastest I've seen her walk in a couple of days.
All right. Good luck.
Thank you.
Pleasure.
I feel really good. I came in really stressed and worried, and now I'm leaving with my sweet girl and her medicine. I'm very thankful, very pleased. Dr. Hodges and his team does a really good job.
Did it really work that fast, baby girl? Did we get that, baby? Oh.
Over here. There you go.
Oh, this is a little special Ferguson concoction that nobody knows about there, so don't tell what's going on here.
Dr. Ferguson mixes a vitamin-filled appetite stimulant for Max the dog, who's been recovering at the clinic.
Can you warm it up?
No, I just got some secret ingredient going on right here.
Oh, he smells it. Look at him.
Oh, look at that. Look at that. We came in yesterday with that elevated temperature just super high, and for a minute it was touch and go. But we was able to get that temperature down, and we ran some tests and found out that we had pancreatitis as well. So we've been treating for pancreatitis, and the baby's doing tremendous right now.
So give me some. Good boy.
You look like you kind of ready to go home, buddy.
Look at a little nub. He's about to shake his hips off.
The Ferguson Special Blend works again. We're in the clinic a lot of time, and these emergencies come in, and you never know how they're going to respond. When we can get them turned around like this, you know, it is a great scene, and with the whole clinic, we're all happy that this baby's going home, walking home. Come on, buddy. I got your buddy back to you.
What's up, Big Pimp?
He is doing a lot better today. But we have pancreatitis. Pancreatitis can be caused by dietary indiscretion. They eat things they're normally not accustomed to eating, cause their pancreas to become inflamed. So treating him with medication for vomiting and medication for diarrhea. He responded real well, and he ate this afternoon, so we're gonna let him go home, okay? Now we're gonna have some medicine going home with you. One's gonna be an antibiotic, and we're gonna send a special food home with you to feed for a couple days till we get this GI, the diarrhea and stuff under control. Okay. All right. Appreciate you, buddy.
Thank you. Now he looks twice as much better. He's back as himself. He's back as a wildcat. I'm very happy. Thank you, Dr. Ferguson, for touching my heart. And I get to bring my own dog home today.
Come on, big dog.
Hey, how's that dog that you removed all those bladder stones from doing?
I've done this a lot of times, but never like this. This is not the norm.
That's crazy right there.
It's been a long time since that dog has felt that light.
But you never told me how many stones you removed.
You know, owners are here, so I'm gonna go tell them first.
Busting out a hotel Hodges.
Today I'm gonna send Zoe home. I mean, she seems happy, she's moving around, she's eating, she's able to urinate. So she's ready to go. What's up, y'all?
Hey, how are you doing? Oh my God.
So she's doing good.
Oh my gosh.
She ready to go.
Hey, all right. Oh, you probably feel so much better.
Now y'all ready for this? 540.
Oh, those are real stones.
Oh, I smell it.
You smell them, yeah. So it definitely came from the bladder.
Yes, ma'am.
Is that something she could have eaten?
No, ma'am.
Can I take a picture of that?
Sure, you can. Final count, 540 stones. That probably beats my record by easily 400. I think maybe I've seen 100 in there before. 500 is unbelievable. I don't know if there's a Guinness Book World Record for stones, but I think that's got to be right up there. She's doing better. As you can see, she's doing fine. I just had to make sure that the bladder was holding.
Okay.
And it's holding.
Okay.
She's good to go. We just got some antibiotics to give, some pain medicine, and I'm gonna send you home with this special veterinary diet. And what this does is it lowers the pH so that you don't get any more bladder stone formation.
Okay. Should she keep that after, though, to
Yes,
kind
ma'am.
of
As
make
long
sure
as, yes,
after?
ma'am. For at least 6 months.
Because we don't want that happening
You don't want that again.
Because she's 11. I mean, she's kind of, you know what I'm saying?
Yeah, I've probably done, I don't know, a couple hundred bladder stone surgeries. And I've got some big ones out, but I ain't nothing never like that.
Yeah, it's amazing. Thank y'all so much.
No problem.
Thank you.
But you're good to go.
I'm looking forward to having my diva back and looking forward to playing with her again.
Thank you to Dr. Hodges and Critter Fixers and just his expertise and experience and all the loving care they showed her here. We're just so grateful. Thank you so much.
No
I
problem.
appreciate you. Thank you for catching
Thank you,
that.
Doc. Thank you.
No doubt.
Wow.
Hey, thank you, Doc.
All right, see y'all later.
Make a burrito. A burrito.
Put it back so it doesn't jump off here now.
A good Samaritan brings in a wild turtle who's shell-shocked.
Hello.
Hi.
How y'all doing?
Hi.
What's up, young man? Y'all good? Fist bump, bam, and bam. How y'all doing today?
Good.
All right. What y'all brought me today?
A box turtle.
A little box turtle?
A box turtle.
So what's going on with it?
Got hit by a truck.
Okay. All right. We're gonna see what we can do.
I found him at the end of my driveway upside down.
Definitely got a split right there.
Yeah. I saw him upside down on the side of the road, and I was actually just going to put him on the other side of the road. And then when I picked him up, I noticed his shell was cracked. He's a little bit bloody. I'm just hoping to get him better enough that I can release him back where I found him.
All right.
See that spot in there? Did you see it back there? Right in the
Yeah, I'm trying to
crease.
right in his nose. Like he got a little split there.
Yeah.
Yeah. We definitely got to get that cleaned up.
Is that a maggot?
Oh, yeah. I'm also concerned about this shell, too. A lot of times it can allow, like, bacteria and stuff to invade there. So we're going to take a look at that. I'm going to x-ray it first just to see what it is and see what damage I think is done. And then we're going to clean all these little nose there and see if we got any more little insects that we don't like up in there. It's pretty bad, but we're going to do what we can. Okay, all right, let's go. All right, so we'll be right back, okay?
Okay.
There's a whole lot of damage. But my main concern is just how much damage has been done and the length of time it's been going on. And so at this point, we're gonna take x-rays. We're behind the 8 ball, but we're gonna give it a shot and see if we can't get this baby feeling better. That's not good.
It hurts my heart. Is this normal?
Those are normal right here.
That grow with her, like growth plates almost.
Yeah, but these things right here are not. Now let's get her back and let's start some betadine, little solution, start gently cleaning those areas up where we know those wounds are, and then we'll kind of work on her nose too. After initially looking at this animal, I knew that it was bad. But after looking at the x-ray, it's actually gone from bad to a grave situation. But we need to intervene and see if we can get some help. But my gut tells me that this prognosis is bad to grave. Somebody want to hold for me?
You want him up?
That way I can see a little bit better. All right, there it is. Give me a thing. I got a maggot here. Got his mouth open there.
Ugh, just swab it, swab it, swab it.
Let me get some forceps.
We got a runner here. All right, we got more. We need y'all to come back. There we go.
There it is.
Got it now.
Did you get it?
Yeah. Let me see if I can flush some. So I want you to hold that up this way so it can drain out. Yep. This antiseptic should kill any germs there. I can see up in the cavity. We got it cleaned out best we can now. So let's clean these other areas up. I'm gonna get my stuff ready here.
What's that you're doing?
Putting like an epoxy on the shell where this crack is, just to kind of be protective, kind of like a layer of skin would be protective, to keep the substances from going inside there.
Feel like you're painting?
Yeah, I'm trying to flatten it out so it's not caked up.
That's good there.
Kind of like watching paint dry in it. All right, so let's work up a dose for antibiotics.
Okay.
I'm still very concerned, just because of the lethargy of this turtle. I'm hoping with the medication that we're sending home and after a few days of rest and treatment that this baby would get this thing turned around. Okay, we got your baby back. On that nose right there, we got maggots out of there.
Oh, good.
See where we put some epoxy on that and it'll get hard there just to kind of close that area up. We went right down through there to here.
Like a resin?
Yes.
Okay.
And all we're trying to do is prevent anything from getting in there, okay? And we got some medicine we're sending home. We got an antibiotic here, okay? Now, you think you can give injections? We got to get some shots here.
Maybe.
Okay. All right, so we're going to show you how to do it here, okay?
Real simple.
But you can kind of see where the legs are there. So we just need to go there. And it's a little tough there. And that's it.
What is that for?
Just your antibiotics.
Okay.
Okay? Once a day, just alternate legs. Now, also, I want you to soak for about 15, 20 minutes in a warm bath.
How much water? Over the nose or?
No. I would just go enough, just about right there.
Okay.
We don't want to submerge.
Yeah, I didn't.
Yeah, with the nose, okay?
Yep.
That's going to help a lot with hydration. And then we got some meds that she's gonna go over with you how to give. And I want you to supplement daily with this herbivore medicine. Work on the baby, do what you can, keep us posted. Anything we can do to help, let us know, okay?
Yep.
All right, so let's try.
Okay.
All right, thank you.
Thank you.
Y'all be good, okay?
Thanks.
All right now.
Very grateful that Dr. Ferguson was able to get her in today. I had actually called a few other veterinarians, a few other rehab hospitals, and nowhere was able to get me in within a week, let alone within a day. He's a great doctor.
Bobby's gonna move.
Maybe I should take him out again.
We've helped a lot of people this week.
But have we helped ourselves?
Are you asking if our office cat Bear has lost some weight?
You betcha.
You know, Bear's a little pushy, but he's kind of trending in the right direction. His trajectory is definitely going down.
You mean upward?
Something like that. It's training day, Bear. Time to exercise. Come on, Bear. Jumping jacks, Bear. Hey, come on. Run it, Bear. Run in place. High knees, Bear. High knees. Bear.
How this training session going?
I've been out here trying to get him to Bear.
Drill, we lost any weight?
We have.
There's only one way to find out. What they do in the boxing, they hit the scale.
Let's hit the scale.
All right, you ready? Come on, Bear.
Come on.
Let's see what's going on.
Moment of truth here.
All right, okay. I know that's right. Get on
Scale
on
don't
down.
lie. Let's see what's going on here.
Go ahead and show them up. You see? Look at that. 7.2 pounds.
Something ain't right.
No, that must be in...
Look at her finger.
That must be...
Look at
Hold on. Drill.
Let's re-tear this.
No tricks this time.
No.
Oh, now Bear
Can
trying
we
to cheat. Bear.
That's right. That's
Back
my
up,
boy.
Bear.
All of you on there. Hey.
There we go. All right, 15 pounds.
See, I told y'all.
That's still
I told
good.
y'all
Hey.
he lost weight. He deserve a treat.
You did good.
No, he does not deserve a treat.
No. Do we have like a light treat?
No,
been
like
losing
air.
weight.
I think we need to make Bear into something else. Instead of vegetarian, he's gonna be an airtarian. We just need to.
he gonna be grumpy.
Let's have air for treats.
He will pee on Hodges' sofa.
This is the Kanye with the golden egg.
So silly. Watch it. Don't drop it. Stop. Hold it.
You gotta stress her out sometimes.
Why do you do that?
The green conure is back. It came in previously, and we sent off for a DNA sex scene. We know what it is. We're gonna pepper this bird with a little bit of celebration.
Oh, I'm sorry. I forgot. No touchy. Hi.
How are y'all?
Great.
If I didn't know better, I think Pepper might have grown since.
A little bit.
Growing a lot more feisty. I guess female.
You guess female?
I'm saying female.
See, we together.
We were settling on female.
That's right, female, okay.
What made you think female?
Just the attitude. Absolute diva.
What you think?
I say girl.
What you think?
I think it's a girl.
Okay. There's really only one person in the room that knows, and that's me.
Oh, wow.
All right. You said male. Mm-hmm. You're on this side, so all the female guesses on this side.
Okay.
All right. Everyone in the room thinks it's a girl except Drea, but we'll see. I'm gonna let you count down. 3, 2, 1, surprise.
3,
You ready?
2, 1, surprise! Oh,
It's a boy. You fooled me, Pepper.
Yeah, fooled all of us.
Yep, come on over, Pepper, and say, hey to the world. This is a new world for you now.
hey.
Well, I'm glad we got the result out. That was fun.
Y'all are amazing.
That's good, yeah. When you need us, holler at us. We'll be here.
We appreciate it.
All right, thank you all.
All right,
Y'all have a good day. Thank you. Y'all be good.
You too.
Thanks, guys.
Y'all
Thank
have a
you.
great day.
Pepper is a boy.
Everybody was wrong except for one technician. I'm glad to finally find out. Still being a little moody? No.
He's a good boy.
You got your leash?
Yes, sir, I do.
Hold on to your leash. Just stay right there. Alice, grab a leash. Come on. Young lady, I got something else I need you to hold. Okay. Meet me with a leash.
Dr. Hodges reins in some reinforcements for a big case.
Hey, what's up, everybody?
Hey there.
Tell me what we got going.
Sheep,
Some sheep? What you got going on with sheep?
help papers,
Hell papers? All right, what we gonna do with these sheep?
showing them,
You show them? Okay. Where you gonna go show them?
Perry,
Perry, all right. How old are you?
13, 8,
8.
8.
8. Take your head off.
Yes, they're twins.
Okay, makes sense. All right. You guys are old enough to be my junior veterinarians today. Let's go out here and check them out.
Today, we brought in our 6 show lambs to get their certificates for health to prove that the lambs are in good shape to be able to do their shows this year.
Somebody go give me another stethoscope. I'm finna make them do some work.
Yeah, that sounds pretty cool.
We're just gonna make sure everybody's healthy and good to go. Show animals have very specific health requirements. They have to be verified by a licensed veterinarian for them to be able to compete. Since these kids are responsible for these 6 lambs, I definitely want to take the time to show them how to keep these lambs in good health. All right, so who we got here?
That's Queso.
Queso. All right, which side will we listen to for the heart?
That's your heart.
All right, it's on your left side. So what do you think is on these guys?
The right side? No. Wait, left.
It's gonna be left too. That's okay. Y'all got a clean stethoscope for them? Or something coming behind? And I'm working to right here. Perfect. It's almost gonna sound like a washing machine. You hear it?
Yeah.
You trying to take my job?
Guess so. They need to do something.
We're gonna do a Femocha test, because goats, they get anemia really quick because of parasites. And basically, the Femocha test is looking for strong blood circulation by checking the eyes and the gums. They want to see a red or pink. What color that look like?
Reddish pinkish.
Reddish pink, that's what we want. When I see kids showing sheep all around, that's the perfect opportunity to enhance that veterinary profession. Here you go. So what side is it on?
The left side.
Left side. See if you can find it. Found it? You just learned the skill, though. That's how we do the heartbeat. We got one more, right? Got to shove in them gums. Quick motion. There you go. Yeah, that looks good. Good job. All right, the job ain't done. Now we gotta go sign this health certificates. I definitely would consider that exam a success. We got some kids that learn. These 6 sheep look great, so I'm super happy. I gotta sign a health certificate. Who gonna sign here? We're gonna let you sign on yours. See, that's your patient. Let me see your signature, your doctor's signature. Let me see.
Not messy enough.
Not messy enough.
Watch his signature. So you can't even read that.
Dr. Hodges.
Well, that's just because you know his name.
And we're good to go.
I think it was pretty cool that he let me help out with the lambs and make sure that they were okay and not sick or anything.
I hope that we can probably just go out there for the first show and get the season going. Hopefully you'll have a ribbon.
Any other questions? Hearts on what side?
Left.
Country kids are always the smartest. I like it. Good job.
Oh.
See y'all later.
All right, thank you.
All right. It's really cool to kind of have that one-on-one when kids at a young age, you were able to teach them some different things. I wouldn't be here without people inspiring me and saying, look, you can do this.
It inspires me to want to be there for them at an early age. So that's why we do what we do, like with Vet for a Day.
You know, speaking of Vet for a Day, man, I can't believe how well our little program is growing. And we've been able to take it nationally.
And how well it's been received in the first few cities we've taken it to. Where are we?
That's the Arches, St. Louis.
St. Louis, baby. I'm very excited about this one.
Everything bigger in Texas. Houston, Texas. This thing has thrones.
Goes on in Vegas, stays in Vegas, right?
So you gonna give me some money?
No, I'm not.
Vegas, baby. And now, today is the big day in Georgia. You ready?
You betcha.
I need my volunteers.
Good morning, good morning. We're gonna get your name tag. We're gonna also get your bag, okay? Here you go.
We're at alma mater, Fort Valley State University, and we're at our second Vet for a Day. We started Vet for a Day last year, and it just took off.
How you doing, Taylor? Okay, we're gonna make it all happen. It's a program for our young kids, and basically what we're doing is we're introducing them to the field of veterinary medicine.
We want to show you how to become a veterinarian, how to stand up and be exactly what we are. So that's what we're gonna talk about a little bit this morning.
I wanted to come to Vet for a Day because just the thought of taking care of animals is my passion.
It's not always about just petting puppies.
We try to show kids scholastically what they need, what class they need.
Also, with some of these minority kids, they've never seen a veterinarian that looks like us.
I've wanted to be a veterinarian since I was probably 8 years old. I never saw a veterinarian that looked like me until I was a junior here at Fort Valley State University. Representation matters, so we want to do our part to help grow that next generation of veterinarians.
We want them to see all walks of veterinary medicine, people who achieve the level of success and people who look like them.
And we have our own Kyle. Kyle is a veterinary student at Fort Valley State University, but he just applied to veterinary school.
And he got in.
To get into vet school, you are required to take genetics, biochemistry.
Dr. Christine Jenkins, man, that's somebody who has national acclaim.
I am the first African-American female to be board certified in small animal.
So the parents and the kids got a lot of information on how to become a veterinarian, things that are important as far as academics are concerned. Now it's time to take them to the Critter Fixer.
Now it's time for the fun. And I'm expecting some big oohs and ahs. I think they're gonna love this.
Oh, absolutely.
Anesthesia in my hand, pack. Ferguson's gonna want a blade handle. Spay hooks in there, right?
Yes, ma'am.
All right, this is the fun part. So we finna go to these stations. So group one, what you got?
Everybody in group one, follow this young lady. Follow number one. This year, our crowd is a little bit larger, so we broke everybody down into groups. And we have different stations, and every 20 minutes, 25 minutes, we're gonna cycle through to make sure everybody hit every station.
We're gonna do some lab experience things in here. We're gonna run a heart rhythm test.
What we have right here is a laser machine. This is literally helping his hips feel a lot better.
This is how we handle some of our exotic pets.
This is Beatrice.
Is she about pythons? Mm-hmm. Very good.
I've seen a lot of things today, and I have to say, I love it all.
They love warmth because they are cold-blooded. When they are hanging around your neck, it's good for them because they get warmth from your body.
As you can see, the kids kind of transitioning behind me. We just want them to be exposed to what we see from day to day. This is no different from an average work day for me. It's just a thrill to be able to show them exactly what we do.
What we're gonna do today is we're gonna neuter. Did everybody see the kitty cat? Yeah. I roll today in the stations. I'm in surgery.
You know me, I'm bouncing around doing what I do best, talking.
Let's pop these bad boys out. So y'all ready? Who there?
What you?
My bad.
Josh!
My bad.
He like, no, he don't want none of that.
I was not expecting to see a neuter. I know what happens during it, but seeing it in person, I was not expecting to see that.
Can you see?
Yeah.
I'm going slow. Come on.
You can see?
That's
Come
not
on,
the
where y'all can
problem.
see.
That's not the problem. We just want these kids to be exposed to what we see in veterinary medicine. You know?
How many times do you have to do that?
I try to do like maybe 4 throws, and that'll keep it from loosening back up.
They may translate this into the human field and say they want to be radiologists or nurses or physicians. It just gives them exposure to a career that they never would see without this vet for a day. I want to say thank y'all.
Second vet for a day, but this is not it. Philadelphia is our next stop on our traveling version of Vet for a Day. This platform is going to allow us to change lives all over the country.
Right.
Hopefully one year all over the world.
I hope so. You have fun?
Yes, I had tons of fun.
Sweet.
Everyone has taken away something different. It helps you pinpoint exactly what you want to do.
Thank you, thank you, thank you.
You ready to suture?
Sure. I just want to work around animals, but as far as surgery, I think I'll faint.
Appreciate it.
This has been a great experience, and I want to do it again.
We had a good time?
Yes.
Really?
Yeah.
We work hard.
Yes.
Sometimes we have some tough days, but today we can go home with a smile.
When it comes together and we have a day like today, it's all worth it.
It's all worth it for sure. Next time I need some help, y'all gonna help me?
For sure.
All right, cool. Vet for a Day went amazing. It's gonna be really cool to help kids all across the nation.
Head out to Philly, and who knows after that?
Exactly. We'll hit a dozen more cities. So Vet for a Day coming to a city near you.
Come on, girl.
Come on, girl. Girl the dog comes to Critter Fixer with a growing concern.
Hey, what's up, y'all?
Hey.
What we got going?
Yeah, we got a tumor on our back leg.
Boy.
We tried to have it treated by several doctors, and nobody wants to look at it, really. All they wanted to talk about was putting her to sleep. They're scared of too much blood loss.
The ear's starting to kind of rot and get necrosed.
Where
she's been licking it?
Yes.
Girl's large tumor has been growing the last 2 months.
So we're just wanting some positive news that it can be removed and not the alternative. She's very loving.
She just wants to be loved on and petted.
She's the best.
She's the best dog we've ever had.
All right, well, we're gonna make sure, as long as it ain't in the chest, we'll see if we can get it off for you.
Yes, sir.
All right, you want to say, come on, girl.
All right, baby girl.
Let's go check.
Let's go take some x-rays. Come on, mama.
We got a little girl here who has a pretty nice sized tumor. It's grown so much that at the end it's open. So that area is starting to get necrotic. The big thing about a tumor is if this tumor is metastasized to the lungs, there's a good chance that it's cancerous, and we'll have to possibly think about putting this baby down. All right, there. Chest looks okay. That's a good thing. Oh, pretty big. This is huge. I'm gonna have blood vessels everywhere that are gonna be bleeding everywhere. Let's go ahead and start some IV fluids.
Okay.
And let's get this baby on the table.
Let's get you down, mama.
Regardless if this tumor is malignant or benign, it's affecting this dog's quality of life. If I don't get it off, it's gonna keep opening and opening until the whole thing is gonna kind of be rotten. I'm worried about secondary bacteria infections from that necrotic tissue, so guess I better get in here surgery and get it fixed. The lungs look okay, so we're gonna schedule the surgery.
Are you gonna go ahead and do it?
I'm finna make it happen.
Oh, good.
And we already kind of a little behind the 8 ball with it open. The faster I can get this off, the better.
Thank you so much.
Thank you.
It's serious. I'm gonna do my best, though.
We just appreciate Dr. Hodges' positivity and willingness to do the surgery, at least try the surgery, and we just wish for the best outcome. We just hope we didn't wait too long to get it fixed.
I got veins everywhere. Oh, boy. Oh, we just got these in the mail. You seen these?
What you got there?
It's a silicone practice pad for suturing different types of wounds.
Wow.
This my thought is the next vet for a day, we're gonna have like over 50 kids. So I was like trying to figure out another station. So we ordered these to see if we could teach some suture skills.
Don't see why you couldn't.
I just figured I'd come in here and try it. So 1, 2, throw. It's pretty cool though. Or I could have went to the grocery store and bought a bunch of pig's feet. I mean, when I was in vet school, we used like a real pig's foot. We got like a pig's feet from the grocery store. Sometimes a piece of silicone is an upgrade. Definitely don't smell like a pig's foot.
Hey, sweet baby.
This is crazy. This is gonna bleed like crazy. Vessels over them like that, man.
And that's what you can see.
Yeah.
What about the one we can't?
It's a big, big, big tumor. I mean, I don't know how much this tumor is gonna weigh, but it's definitely gonna challenge my surgical skills, and I'm sure I'm gonna go home pretty bloody.
Sitting here thinking it's not a tumor, like the tumor over your lifetime.
Mm-hmm. Somehow I gotta peel it out, keep the integrity of that bone, make sure that I don't get any kind of sepsis or anything in that knee. So it's definitely gonna be a challenge. This thing heavy, boss.
Good Lord, man, like an udder.
See what we got, boss. Yep, we about to bleed. Mess. It's pretty dang old vascular. It's a mess. It's a big mess, yeah. More gauze, more lap sponges.
You got more lap sponges in here, Doc.
Yep, thank you. Talk to me. How my blood pressure?
So far, so good.
This is such a dangerous surgery because of how vascular this tumor is. I'm gonna have to get through this surgery as quickly as possible so there's not too much blood loss. I'm just trying to bride around as I start to try to peel my tumor away. It's like being in a heavyweight fight, boss.
Oh, man, real nasty.
This is about as bad as it gets, and I'm still trying to peel it away.
While Dr. Hodges keeps working to remove Girl the dog's giant tumor.
Let's go, y'all.
Dr. Ferguson and Andrea take Kyle the intern on an out call as he gets ready for his next step.
Kyle, your time is winding down, buddy.
How you feel?
Actually pretty nervous about just the whole transition. The vet school part is not what's nervous yet, but just to like living on my own, so young.
So young.
What do you mean so young?
I'm turning 21 in like less than 2 weeks.
Kyle, I was out the house at 15. I was living on my own, paying bills.
I'm like, what?
Nah, but it's gonna be cool.
It's not gonna be cool. Don't listen to Doc. Paying bills is overrated. You hear me?
Get every day you can. They give you 5 days extra, you better take the 5 days.
Lord, no. My mortgage due on the 17th. I'm paying that mug on the 16th at 12.
Good morning, good morning.
Good morning.
How you doing?
Just fine.
Nice place, I tell you. You pull
Thank
up and
you.
always see llamas everywhere.
Yes.
How many you have?
We're right at 50 now.
Wow.
50.
We started with llamas when we bought our first one, and people told us we had to have companions, that you couldn't have just one llama. And then it's grown to where at one time we had over 75. One has a skin condition we've been looking at with the allergies. We've treated it for mites and done different things. So
Yes.
we're just looking for new solutions.
Well, we're gonna try to figure some things out. We're gonna walk this thing down till we make it work.
There you go.
All right. Today I have Andrea and I have Kyle. And Kyle is one of our sort of intern students that's getting ready to attend veterinary school. So this is a good out call for him to kind of get him baptized, and I want to make sure that he is ready for this veterinary school.
It's a whole world of it.
Yeah, you need to start rolling, Kyle. He's getting ready to go to veterinary school. So one of his things he had to do is he needed to roll in some manure.
We're gonna get you dusty today.
Right. What's her name?
Blackberry wines.
Blackberry wine.
They call it blackberry. She started with a little of this on her front legs, and then some. It'll come and go.
And how long this been going on with her?
2 years.
Definitely at this point, because of this skin problem, she's developed a secondary bacterial infection. That's what the results that you see here. So primary cause, we got to figure out here. The game plan right now is I want to do a skin scraping to start with. These guys can't have mange. It looks like that's possibly what it is, but it also has developed a bacterial infection. So we want to just kind of pin that down so we can get the meds on board and get this baby looking better and feeling better.
Go around. Come here, girl.
I may come on that side.
Oh. Yeah.
Get kicked.
She kicked you?
Mm-hmm. Yeah. It's all
okay,
right,
girl.
I'm gonna go right here.
All right, girl. Here we go. It's okay.
You roll that chute out hand.
Okay, all right.
Put her in it.
Yeah, that's probably, watch out, Drew.
Can you get some help? I'm gonna help him with the chute.
Blackberry wine is not being cooperative in this corral. That the owner has a stanchion here. And what a stanchion is basically like a head gate or a head chute that you would use for cows. And it's something that basically restrains them and keeps them from injuring themselves and allows me to be able to examine them without running the risk of getting injured.
Easy.
All right. It's all right.
All right, girl. Here we go.
What I'm trying to do is rule out whether we're dealing with some kind of mange or parasite. Even if I don't see it, it looks like that's what it is. So we're probably gonna treat, but I really would like to see it if I can.
But one thing, Kyle also need to get spit in the face, wild llama.
What are you telling that man there?
Yeah.
Okay.
Not seeing anything, not anything abnormal. I didn't see any parasites so far, but that does not rule them out because we don't see them. Main thing that we have here is we developed such a severe secondary bacterial infection, and that's what's causing all that crusting and the inflammation on that skin that we see. So we need to treat a couple things. One is we are gonna treat as if we still have mites. We're gonna treat externally. I'm gonna give you some meds for that. But also we're gonna go on some antibiotics, and we need to go over them for at least a couple of weeks or so to clear this thing up, okay? So we're gonna start out with an injection here of an antibiotic. All right. We're gonna keep our fingers crossed. You know, I hope that there's something that doesn't progress any further. If we can just hold it and keep it where it is, this baby's gonna be fine. Come on, Kyle, come on.
Huh?
Come on. Squat down.
Squat.
Yeah.
I did.
There you go, you ready?
That's Fred there.
I knew it was a setup.
Oh, look at you.
I knew.
My God.
How does it smell?
I ain't scared of it. I've been in vet a long time. He's definitely baptized now, and he's this close to being ready to go to veterinary school. I'm proud, man. So when you go to veterinary school this fall in Tuskegee, you just tell them you've been to the mountaintop. Thank you, Mr. Fool.
Thank you.
We'll see you later.
Oh, I'm feeling great. I think we're on the right path. It sounds like, you know, some things I hadn't even thought of, but it does sound logical. And that's what thinking outside the box that Dr. Ferguson does. He can find what the real problem is, and we'll attack it.
Big vessels in here that I don't want to bleed.
I know. That's why I'm looking at this blood pressure.
Back in the OR, Dr. Hodges is still hard at work trying to remove Girl the dog's massive tumor.
I mean, we still good, but keep watching and see what you're cutting.
Oh, boy. And now the moment of truth. Got your pen, all right. Here you go. Yeah.
Oh, girl.
I said 6 pounds.
Yep.
Trying to now figure out exactly how I'm gonna make this come back together.
It's the home stretch, Doc.
I need to get home a little faster. The blood pressure a little low.
All right, can you get more glycopyrrolate? Gotta have that blood pressure up. I'm gonna get off this table. Glycopyrrolate is a drug we use to increase the heart rate, and with the increased heart rate, it also raises the blood pressure. It's always a race against time. Every time I'm with you, I'm always racing against time.
Because you like to do all this daring, dangerous stuff.
Come on, puppy dog. I need a blood pressure up. Come on now.
You're finna get one more blood pressure reading. Yeah, blood pressure up a little bit.
Yeah, man, it's a good thing. That was scary. I was cooking with grease, guys.
All right, she good.
That looked pretty good. This is definitely one of the biggest tumors I ever removed. With the blood pressure and blood loss issue, I'm gonna have girls stay at Hotel Hodges overnight. For now, I'm just glad we got this huge thing out of this poor baby's leg.
Wow.
Yeah.
Does that look a little bit different?
Yeah, a lot different.
Hey, baby.
Hey, girl.
So she'll probably just stay with me for a couple days, but that look a whole lot better, huh?
Look a whole lot better.
So much.
Yeah, I know you weighed it.
Oh, yeah, I'm gonna show you.
I'm scared to even know. Oh,
Take a picture of it. Oh, my God.
Man.
Right at 6 pounds.
Do you think it was cancerous?
Looking at it, more than probably is.
So what do we do from here?
We just can monitor, see what this is. I mean, you can always do chemo. Even though I got this out, she's still not 100% out of the woods, because that was pretty intense, but this is the first step.
We know she's gonna be all right.
Thank you so much.
We're relieved that girl has made it out of surgery and everything looks positive and promising.
Just so thankful it's over and we can look forward to getting her healthy again.
More than we could have asked for.
Much more.
Bye, girls. Yay. Bye, baby. Bye, baby. We'll be back.
Jordan, if I'm down to starvation, you got some dog food, bring it, because I'll eat it. I don't want to die.
You still keep saying that and you ain't done it yet.
See, oh, I got Luna. She's pregnant. I'm about to give birth. I noticed she was struggling. Seeing her in pain made me paranoid. That made me think, I gotta take it to the vet and do the right thing for her and the puppies.
Hey, man, what's up?
Hey, how you doing?
I'm fantastic. So who you got here, bro?
We got Luna.
Luna?
Mm-hmm.
How far along would Luna be?
I think she's real close.
Real close?
Yeah, she been pushing and...
Uh-oh. How long has she been pushing?
Last night.
Okay. Hey, Luna.
Belly full of babies.
Let's see. Oh, yeah, it's stuck. Small pelvis. Yeah, we gotta get this dog on the table now. Hey, get that in the surgery. Yeah, super stuck.
All righty.
All right. Hey, Michelle. It's literally one stuck in the pelvic canal. Can you do an emergency x-ray just to see what I'm working on?
Okay.
This is a really bad situation when a pup gets stuck like this. It can possibly stop breathing. It also starts a roadblock so that all the other puppies can come out and they could possibly asphyxiate. All right, you can go.
Okay.
Yeah, thanks. So this is my problem. This is why it's such an emergency. You can actually see the head of this one. You can see the mouth gaped open. It's coming in the canal. This guy is stuck all the way out. Got him here, 1, 2, 3, 4, 5, 6. But as you can see, these guys are stuck in here. So this is definitely an emergency C-section, because if I don't get these out, these puppies gonna die. Just hoping they still live.
How many puppies are we expecting, Doc?
6, hopefully. There's a puppy stuck in the pelvic canal, so we gotta get right to surgery.
IV catheter's in, she's already on fluids.
When you go in, you feel a puppy that's stuck, you know that this is real bad. It's almost like a train, you know? You can't get the caboose out unless you have the engine come out, and in this case, the engine was blocking everything up. All right, initial incision is made.
Man, it's a big baby.
Big. This is the uterine horn. This is where all the babies are located. This is the baby that's stuck. I'm gonna see what we got going there first. Ah, boy. His head is actually stuck in there. You got something I can put this puppy in? Unfortunately, it's the one that was stuck. Whoa.
You got
Whoa. Slight. Doc, work on this baby. Felt a slight heartbeat. Unbelieving now. Coming out with a pup.
Pup number 2, pup number 3.
Pup 4.
Here we go, Ari, over your head.
Come here, baby.
I got another baby coming up.
Oh, that's a lot of mucus. Yeah, a lot. They all have a lot of fluid.
Because of the backup, all these puppies, they're still in this amniotic fluid. As they're getting stressed, the amniotic fluid is going inside the nose, the mouth, and when they come out, these puppies aren't breathing. Doc, I got one more coming. Make sure one of y'all work on it for me.
Okay.
Here go the problem child, Dr. Horton.
Let's go ahead and get her sewn up.
Who wants to craft it? Is that you? All right, that's one. We got one crying so far. The other ones are working on it.
Okay. Definitely want to hear one crying out there. I hear some squealing.
There we go. All right, baby, I hear you.
Hear some squealing, Polly.
Mm-hmm. Now this one's a trouble. There's no heart rate. I can take over. Here you go.
It's just this one left.
I don't hear a heart rate anymore. So he was blocking her probably, and
Andrea, you heard the final tally?
So we had 6 dogs, we lost 2.
That one and then the last one?
Mm-hmm.
That's pretty bad shape coming out.
Yeah.
Sucks.
You ready to get Mom off the table?
Yeah. Feel good that we got Mom off the table. She seemed to be doing pretty well with anesthesia. Good news is this pup is definitely a lot better than when it came in. We talked to the owner. Fortunately, he got us to us, and we were able to save 4 of those puppies. Mom's doing good, but I only saved 4 of the puppies.
Appreciate it.
But come on, we'll go look.
All right.
But Mom is coming off the table, and she's doing good.
Oh, great, great.
And here's your babies.
Oh, my God, look at them. Oh, my God. Look at this one right here.
Yeah.
Oh, man. I feel it.
You feel it?
Yeah.
You get no chill, bro.
Yeah.
I'll come get you when Mom wake up. She'll be busting out of here.
Appreciate you, man.
All right, they ready to suckle?
4 is better than nothing. Feels great. You know, my girl's going back with me, with the puppies. Appreciate everybody over here.
I need your help with these.
Now, this kind of help, I can do this.
You can do this?
Yeah.
Well, I appreciate it, brother.
Yeah. Y'all some wiggly little thing here. Hold tight now. Hold on, hold on.
Yeah, hey, mama.
Take care of them babies, mama. Okay. They doing their thing. We're off to Philadelphia.
Our head is on the swivel. We ain't got to look up in Georgia.
Back in the day, man, how did they build such elaborate buildings?
You know, you probably was born when this building was born, I mean.
That's what you trying to say. Philadelphia is the home of our nation's founding brotherly love.
And cheesesteaks, man. You can't forget the cheesesteaks.
You know which one the best? The one I don't have to pay for.
Look.
Most importantly, Philadelphia is our next stop on our traveling version of Vet for a Day.
How y'all?
Good.
Yeah, this is my clique right here.
Her name is Happy. She's actually pregnant.
Her name is Happy?
So the baby name is supposed to be Happier.
Happier.
Yeah.
That makes sense. That makes sense. Today we're at Walter B. Saul High School, and we're gonna do our Vet for a Day right here in this high school, and they got their own farm, so I'm super excited. I mean, like, what school, high school got a farm?
It was like plenty of times where like we got like dragged by our cow because she's like dragging us up the hill, and we're like, okay, we have to take you back down, all the way down the hill and go back up. Yeah.
Oh man, that's cool.
Walter B. Saul High School is the largest agricultural high school in the country, and it's located right outside of Philadelphia.
And the idea is to expose city kids to agricultural careers they may not have considered before. Just like Vet for a Day exposes kids to veterinary medicine.
Which really makes this school the perfect partner for us. For this class of been, had you seen a cow or touched a cow or anything?
I'm a hands-on learner, so I like to have a lot of hands-on experience, and to see Dr. Hodges and Dr. Ferguson firsthand, it's cool to me.
We kind of jealous, and how we took it long. I mean,
We didn't have
you get to come to high school and get a cow.
It's like a learning experience
Oh,
and
it's
like
great.
a class experience because
Yes.
it's like you learning how to take care of a cow, but
Right.
also you're like bonding with the cow too.
Yes.
Honestly, it's like an honor to be here because it's kind of like a dream of mine to be a veterinarian.
All right, what is she doing now?
She's doing her cut right
Hey, whoa, I don't say that. Hold on now.
To be here and to talk to the critter fixers, it's just like once in a lifetime.
You might urinate. What?
Hey, where y'all going? Y'all going?
We had to back up. It was a splash zone.
We just talked about the chewing the cud, right?
Yeah.
And the other stuff come out of it.
That's right.
These kids are amazing. You can tell they're really smart, but poop and pee come out. They quite ain't really sure what to do, so they kind of jump it back. I'm like, look, stay in here. It's just salad.
So is this a beef breed or is this a dairy breed?
Dairy.
Dairy breed?
Yeah.
You know what breed she may be?
She's an Ayrshire.
Ayrshire?
Yeah.
It's really great to see how much these kids know about farm animals. One young lady, Jasmine, really impressed with her passion.
So if you feel a uterus or you don't feel a baby, feel one, what do you say?
Open.
Real.
Say it loud. Loud. You gotta say, open! All right, good. All right.
I'm really shy, so I'm not really the outgoing type.
Good job. Good job.
It's kind of like a little overwhelming, but it's like a good experience because Dr. Hodges and Dr. Ferguson know what they're doing because they do it all the time.
All right, you guys, we're heading back to the other side and do some other cool stuff. These kids know a bit about farming, but the best way to get Jasmine and these other kids pushed forward is to give them some hands-on experience.
Exactly, you know, which is one of my favorite parts, especially the suture section. I'm gonna cut my arm like everything, right? And then I'm gonna be bleeding everywhere. So y'all better be ready to sew me up.
This instrument right here is, you know what it's called?
That looks like a tweezer.
I knew you were gonna say tweezer.
Tweezers.
No tweezer, all right?
A thumb twister.
Ding, ding. All right, good. All right. So when we're sutured, we never want to put our hand on the tissue or whatever we're using. We always want to use our instruments, right?
This is sterile.
That means it's clean.
It's clean.
Go ahead and start here and here. I want you to pull that together.
I think the critter fixers are really cool, honestly. And then it's a good opportunity to let me find out really if I really want to do this, which I do. So I'm like, oh, I get to do what they're doing.
That's a needle, right? So you're gonna do something called a throw, which is a type of stitch. So I come through one side, and we're gonna do a what?
A throw?
A throw. I'm pulling it through. Other side. Did you catch it?
No. They're like the doctors, so they know what they're doing. Like, okay, let me not mess up in front of them.
I'm just gonna let you make one throw. Grab your stuff.
When we're sutured, we never want to put our hand on the tissue.
No, hey, you know, it's sterile. You just killed my dog. Open it. Yep, we're keeping it tight. Grab it. There you go. All right, now you're gonna just pull that through. Keep holding it, keep holding it, keep holding it. Come on, pull. Oh, you just saved the dog. You got it?
Yeah.
Well, here, practice.
And Dr. Hodges and Dr. Ferguson, they're very good at explaining things because I was kind of fidgety because I've never done a suture before.
Don't get too close to the edge. Back up a little bit.
There you go, make that throw.
That way it won't pull through, so go about here.
The way they explained it, it's just like, okay, I can do this. Just listen to their directions and you can get through it.
There you go. Good. Bam. Good job.
Thank you. It was really a good experience. It's like an eye-opener to a lot of things that I never knew that I could do.
I think it's cool that you get to talk from vets, like, from all over.
Yeah,
yes.
All kinds of vets. Who are your favorite?
You guys.
Okay. Okay.
It's always been a dream of mine to meet and learn from Dr. Hodges and Dr. Ferguson. It's very special that I get to be here today.
Well, we're glad you all came out today and glad you learned something.
Yes.
I definitely think Critter Fixers' Vet for a Day program in Philadelphia was a success.
Definitely. I mean, we got a little taste of Philly, and Philly got a taste of the country. Sometimes people bring in squirrels.
Pet squirrels.
Come on to the country. No matter the city or country, we're here because of our passion of helping animals.
We want to pour that out to others so that we can make veterinarians all over the world.
All over the world.
All right, 1, 2, 3, smile.
Okay, yeah. We're almost ready, Brittany.
Hey.
Hello.
What's up? How are you?
I'm fine. How are you?
I'm doing well. Tell me about this baby.
She has not been eating or playing.
How old are we?
6 months, maybe?
6 months.
Today I'm here with Brittany Snow because she is not a playful kitten and she is spending most of her days as a lazy cat, and that is highly unusual for Brittany. I don't know what's going on with her, but hopefully Dr. Hodges and his staff will be able to point me in the right direction and help me.
Any vomiting?
No vomiting. The only thing she did do was urinate on the kitchen ceramic tile.
I'm gonna go check her urine and her blood. I'll be right back, okay?
Okay.
Sometimes you get some cases that are quite curious. You're looking over the cat, and the cat looks totally fine. Cats usually use the cat box unless something going on with it physically or psychologically.
See a few drops.
The bladder seems really, really small. I'm gonna check CBC, and then we'll do a urinalysis, and we'll kind of go from there.
Hey, Doc.
Yeah?
I got some results for you.
All right, white count looks fine.
You can see them real good on the computer.
Let's see what we got. Oh, yeah, so that explains why we peed.
Mm-hmm.
We got struvite, which are crystals in that urine.
All right.
We got a UTI. Let's just make sure there's no stones in the bladder. Crystals are often found in cat's bladder when the pH is too high, which basically leads to bladder stones. And bladder stones are bad because oftentimes we have to surgically remove them. Bladder, I don't see any stones. You gotta eat though, huh? You have got to eat. Fortunately, we caught this UTI pretty early. We're gonna just change this kitty's diet. We're gonna get some antibiotics on board, and this kitty will be right as rain or snow in no time. I got pain medicine, I got something to help with the appetite, and I have antibiotics.
Okay.
So, we got a UTI. Our bladder's hurting. One last thing, and food. We gotta change the diet for a while. We're gonna do a urinary formula, And so this dissolves the urinary crystals.
It is great to know that it is treatable and that it is a UTI, although I did not know that cats could get a UTI. I know humans do, but that's just something that I'm learning.
All right, just keep us posted and good luck with your baby.
Oh, thank you so much.
You're
You
very
guys are so great at helping me, so
No
thank
problem.
you. I'm just looking forward to many more play dates and many more days of enthusiasm, because I was really scared, but now I am just a happy parent.
All right, Brittany, let's go.
Hey, he's okay.
Ask Dr. Hodges to come to X-ray.
Associate veterinarian Dr. Porter consults Dr. Hodges on drop-off patient Julius.
Hey, Dr. Hodges.
What up?
This case here. Julius, it's a Shar-Pei that has had some chronic vomiting over the last week. He's not keeping any food down at all. He is now having diarrhea. And the odor thinks that he may have eaten something that he shouldn't have.
Who is the client?
It's one of our coworkers, Abram, the aspiring veterinarian.
Yeah.
He's not working today, so he dropped Julius off for an exam.
Huh, I should make him come do it. This dog belongs to Abram, who actually volunteers here. And I actually met him through our first vet for a day. Definitely is a little bit of added pressure knowing that a kid who looks up to you, who's come through vet for a day, his dog is really sick. Okay, might have something there. It's always better to look with endoscope than the surgical knife first, so I'll go ahead and take a peek.
Yes, sir.
All right, thank you. Julius may have something in the stomach, so it's really hard to tell exactly what his dog could have eaten. Did you eat something, Julius? The beautiful thing about minimally invasive procedures like the endoscope, a lot of times when we're not sure and we feel like it could be something there, we always can go with the old fishing rod and look around and see what we see in there.
You ready?
Yeah. Let's go down and take a peek. Okay, keep going.
Feel like you're eating something.
In the stomach.
Yeah.
What is that?
Oh.
Can at least see the inside, huh? Okay, I just seen a clump, like a paper or something. Okay. Doc.
Yes, sir.
I see pieces of paper in there. So I think it has shredded his stomach a little bit.
Oh, yikes.
Got a bunch of GI ulcers in there.
Wow.
So that's why he's vomiting.
Uh-huh.
I see really, really damaged gastric mucosa, or basically gastric ulcers. His stomach kept producing gastric acid, trying to dissolve all those paper particles, which aren't food. So that stomach acid keeps irritating, and the fluids keeps building and building, and it causes all kinds of gastroenteritis and gastritis. It is very painful, and it causes the nausea and vomiting.
Suction that out.
Yeah, okay.
Mm-hmm.
But look like the good news is there's not a big heart of it. The bad news is a bunch of paper. Kind of messed our stomach up a little bit. Yep, that's what's going on.
Wow.
We got the paper removed from the stomach, and we'll do some antibiotics and some stuff to coat the stomach and start treating those gastric ulcers. I'm gonna keep him in Hotel Hodges, and hopefully he feels better. We're gonna keep him on IV fluids, and now it's just a waiting game.
Come on, buddy.
Every now and again, I'll dip in the like the Georgia twang. Example, y'all stress y'all. The word is y'all.
Did he say dip in?
Oh, Lord.
I don't know, man. We definitely getting old, because, I mean, I'm looking back at the hundreds of kids we've probably helped over the last 20 years.
Like Kyle, who got into veterinary school, and now we have these young kids that want to become veterinarians that we're gonna help them.
We do our vet for a day, and we showing them a pathway to become a veterinarian.
It really feels good.
For sure. It's as good as fixing animals.
Hey, what's the verdict on Girl, the dog with the 6-pound tumor?
Verdict is definitely the right word, because that tumor removal was a trial.
The tumor over your lifetime.
This is about as bad as you get. But good news, Girl survived that surgery. She went home with her family, coming back for a checkup.
Just the verdict I thought. You're a good surgeon.
You're guilty as charged.
Baby, the doctor's gonna be in here in a minute.
Hey, hey.
Hello.
Who you got here?
This is my grandson.
What's his name?
Easton.
How you doing, Easton?
Good.
Who you got here?
That's baby girl.
Baby girl. How baby girl doing?
Oh my gosh, she is so much better.
Really?
She's got her spunk back. I mean, my husband got home from work yesterday and she jumped up on him. It's been so long since she did that.
Let's see what we got here, baby girl. That looks good. We got a little fluid in there, but that looks really good. I mean, that has healed up really nice.
Mm-hmm.
I'll be right back, Easton. How about that? Come on, puppy dog.
We getting that cone off today, I hope?
It is a good chance you are. Ooh, boy. Some cases just make you feel good, and I feel good. I mean, that was definitely a challenging case. A big tumor like that, all those vessels, I mean, definitely could have went another way, but this is one of those times that makes me proud and happy to be a veterinarian. This looks a whole lot better.
That's right. I'm sure he's getting around better, they say.
They say jumping up and everything?
Yeah, I think you took some off me like that. I'd jump too.
And the whole dog just looks better. They're great clients. I mean, I can tell they love their dog, and I'm up for the challenge. You know, all the other vets wanted to euthanize girl. I'm just glad she came to Critter Fix so we can make them happy, and it just makes me feel good.
Hey, one thing you didn't think about.
What?
How many staples you put in here?
A lot of staples. I was just trying to get in and make sure everything held up in it right, girl. Last thing we needed was it not to hold up. Even though this tumor was likely cancerous, removing it has improved girl's quality of life. She can go home comb-free, staple-free, and most importantly, 6-pound tumor-free. Easton, you notice anything different about the dog?
Baby girl.
You ain't gonna get as good a satellite reception in the house. You are done with that comb. We removed the staples, and the surgery site looks so much better. And the little fluid you have now is gonna drain. It'll absorb. Kind of like a person with lipo. It's just gonna keep getting tighter and tighter and tighter. She is good to go.
Yay. Thank you so much. We are so blessed and so thankful for Dr. Hodges and everything he's done for us. It's a true miracle. She is the heart of our family, and she is like nothing has ever happened.
Bye, girl.
Hey, girl.
See you later.
All
Bye,
right.
Easton.
Thank you so
All
much.
right. You scared us, buddy? Hey, come on. Let's go see Abram, buddy.
After getting a couple days of stomach and bed rest at Hotel Hodges, Julius the Shar-Pei is back on his feet.
Hey, Julius. Hey, Abram, what up, man? And Julius bounced back, so that's really a good thing.
See, I'm back to his normal self.
Come on, I'm finna prove it to you. Come here. Abram began volunteering at the clinic after his first experience with our Vet for a Day program. He's enthusiastic and eager to learn more about veterinary medicine. And now I'm about to teach him one of the most important lessons in our profession. He left you something to clean up.
It would have been a mess right there.
So you got something you gotta come clean up, but it looks normal. So you know as a veterinarian, poop is everything.
Yes, sir.
The consistency and makeup of the poop is one of the most important indicators of health of a pet to a veterinarian. And in this case, now there's no diarrhea or paper in this poop. We know that Julius is a healthy dog. But that was a lot of paper in it.
Hey, he must have walked around and found
Does he
stuff
eat
laying on the
stuff?
floor. He likes to eat a lot of stuff.
So next time, since you've been to vet for a day, you should be able to fix him next time.
Maybe. If you guys let me get on the table.
Julius will be going home today with some meds and a special diet, and I think we should be good to go. You was part of our first Vet for a Day. What'd you think?
I learned a lot from it. I learned being a vet is not all just about playing with animals
It
and
ain't.
taking care of them.
And you got to get in vet school, you got to have good grades.
Yes, sir.
Scholastic and grades is a big part of it because it's very competitive. You know how many vet schools there are in the country? 32.
Ooh.
Ooh is right. So that's why you got to have good grades.
Yes, sir.
You started as a vet for a day. Now you're a volunteer. Who knows? You might end up with a job. How that sound?
It's pretty good. It sounds pretty good.
Well, you keep working on it.
Yes, sir.
Oh, Abram, you meet a kid who you hope to brighten their life. And he actually brings some sunlight to my life because he's really a good kid. He's very manimal. Abram.
Yes, sir.
You forgot something?
Ah.
He asks questions. He's very inquisitive if something's going on. So something like that definitely keeps you young. And I need all I have out here to keep me young. All right. All right. Some pooper scooper out here. We got a new puppy in here.
Okay.
Hey.
Hey.
We have Boston here for his first puppy check.
We're hoping to get up-to-date vaccines and make sure he's all healthy since we picked him up last week.
Amazing dog, what I heard about the name.
Yeah.
So this is Boston.
You can call him Boss.
Could have been worse. They could have named him 28-3. We'll say Boss, that works. Although this is Boston's first visit, Carrie and David have been clients of mine for a long time. He's a New England Patriots fan because he's a transplant from Boston and has another dog by the name of Brady. And I'm an Atlanta Falcons fan, so we got quite a bit of a sports rivalry going on. How's the appetite?
Good.
Good.
You do have a little red conjunctivitis.
He does have some discharge.
You can see the staining.
Yeah. Hey, so cute. All right, I'm gonna get the poop back here. I'll be right back.
No problem.
That is an absolutely gorgeous puppy. We got a Boston here, so I guess I'm gonna name one of my dogs Atlanta.
That'll work.
A lot of times we deal with a lot of life and death, but we deal with new puppies and educating the owners. I'm gonna check a stool sample here.
All
Hey,
right,
sweetie.
buddy.
Which is always good to see the start of a new puppy's life. So we're just waiting on our stool sample. You look more like an Atlanta to me. You always want to kind of look at their eyes. In this case, we got a little bit of red. One thing about Georgia is allergies.
We good.
All right. Boston's fecal sample came back negative. Everything else looks good. I just need to vaccinate this pup and make sure these eyes clear. Everything checks out.
Any suggestions on the discharge?
Yep, we got some drops for you. All right, so you won't go ahead. You're gonna go to the side. Just a little bit right there.
Yeah, how many times a day?
Just once. And that'll help beat Georgia allergies. Amazing animals. Poor choice in sports teams, though.
Yeah.
Don't start. Hey, we didn't win a national championship.
Thank you.
As always.
Yep.
My man.
We've been clients of Critter Fixers for years, and Dr. Hodges has always been great to us, great to our family dogs. Emergency, non-emergency, it's an awesome place, awesome people, awesome doctors.
It's a good boy.
It's almost cool to be able to bring your dogs to work every day. Whoa, Nelly. Whoa, 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 whoa. Hey.
Okay. We're gonna ask him about your eye. Hi.
Hello, hello.
How are you?
How you doing? Trying to get that last bite? But that Sonic must be good. I heard it good now.
It's hot outside.
It sure is. What's up, Morocco? Oh, that's how you going.
Yeah, we're not in a good space. Got two issues.
Yes.
Morocco is my oldest of 3 dogs. He's kind of the adult, so when everybody wants to play after a certain time, he's like, okay, that's enough playtime. Everybody needs to like take a chill. So he's my little security dog. Our left eye has been red.
Okay.
But the biggest concern that we have there is like a fleshy lump on his chest. It seems about the size of a quarter.
Okay. Let's get him up here and take a look. Come on, buddy.
Come on.
So how long has the eye been red here?
Just a couple days. Like, it was worse yesterday.
Okay. How old is he?
He'll be 9 on Friday.
You got a birthday coming up, buddy? Okay. What I want to do for the eye is stain the eye to make sure there's no scratch or anything on it that's causing it to be red, okay? Now, the next thing is point out this little spot here. Let's see what we got.
Right here, that lump right there.
While we got him back checking the eyes, I'm going to take a needle and just get a little sample, put it on the slide, and we'll send it out to the pathologist, okay?
Is this normal because of his age?
As they get older, they can develop different kind of cancers and things, which is why we need to be definitive with our diagnosis here.
Okay.
All right, we'll be right back.
All right, come on, handsome.
Just taking a look at it, it looks like there's definitely some conjunctivitis, but I want to put a dye in the eye to be sure that there's not a scratch, abrasion, or ulcer on the eye, because that's going to determine what kind of medication that we put in that eye. There we go, buddy.
Just one eye?
Do both, since you asked.
Okay.
All right, you ready, buddy?
Oh, got a spot.
Mm-hmm.
Little bitty one.
What I just pulled up was what we call the fluorescein stain, and it's basically a solution that will fluoresce with a black light. So if there's an ulcer or anything on the eye and it have what we call uptake, then we'll have an area on the corner of the eye that will fluoresce and tell us that we have an ulcer.
Morocco, that's a good boy.
All right, you ready? You can feel the little lump in there, though.
Oh, yeah. He's a good boy, Morocco. Good boy.
Do you know where Morocco is, Ruth?
Is it a dance?
Is it? No, not a Morocco. I said, where is Morocco?
Oh, I barely leave Georgia. What are you talking?
Oh, yeah. That's a good one right there, bro.
Just fat?
Mm-hmm. My thought right now is that we have what we call a lipoma, which is just a accumulation of fat. Because of the age of the dog, I still want to send this slide out just to be definitive.
All right, Mom.
We're back.
It's okay.
We want to show you a little something here, so I'm going to flip the light off.
Okay.
Okay? Now, you can see it around the eye. That's okay, but you see the little spot right in the middle?
Uh-huh.
It looks green?
Uh-huh.
Yeah, so that tell you that there's a little scratch there. Okay, so we got some medicine to help. It can be caused by bacteria. It can be caused by, well, we just had a scratch in the eye.
Okay.
Now, I got a sample of the area on his chest.
Okay.
Just from my initial interpretation looking at it, it looks like fat.
Okay.
Which is best case scenario, okay? But we're still gonna get it sent off to the lab. Once we get that report back, we'll call you.
Thank you. Dr. Ferguson has been great. As always, he has a gentle touch. Regardless regardless of the results, we're gonna make sure we just have positive energy. We're gonna make sure we do what we have to do, and we're just gonna keep on going. Say thank you.
All right, y'all have a good one.
You too.
All right, then.
I'm ready for the cat now.
Okay.
You ain't got an X-ray no more, because it's broke.
It's broke.
Broken. Might be still kind of half together, but broke. You don't want a broke.
Aw.
You don't want either one, but if you had to have one, you want a little break or fracture, not a broke. I'm thinking Critifixer may need to make our own medical dictionary. We got boogered up. Girl, you can't find that in the regular dictionary.
Broke.
Broke. What do you think?
That's a good idea. Eudemus.
What about tore up from the floor up?
Oh, yeah. We
definitely put that one
need
in
to
there.
explain that one.
Yeah, we got to explain that.
Everything's bad.
That's right.
Everything.
Yeah, everything. What other descriptive words we use around here to describe our stuff that's probably not in the book?
My favorite one will always be ADR. It works perfectly for, like, just about everything.
Everything. Ain't doing right. So that's really when you really ain't sure what's going on? What's wrong with him?
ADR.
I don't know. ADR. He ain't doing right. I'm getting some new book ideas.
The team heads out to a first-of-its-kind house call, and Paul is ready to dive right in.
Oh, what you think about going to see an eel, man?
I'm excited. I have been doing a little research, man. They're actually a really popular pet. I mean, what you think about an eel? Want to get one for the clinic? No. You said you treat them all. I'll take care of it. You buy it.
They are notorious for jumping out of their tanks. You read about them jumping out of the aquarium, and I don't want to come in and find an eel on the floor. No, absolutely not. Hey, man.
Dr. Hodges, how you doing?
I'm doing well. How are you?
Doing good. Thank you for coming. This is Chastity.
Ooh, boy. This is huge.
She's about 4 feet. She has a tumor on her face.
Oh, my God.
Today, I have Dr. Hodges and the Critter Fixers team to help my moray eel. A lot of people don't like snakes and reptiles and things of that nature, but I think they're just misunderstood. When I saw her, I just had to have her.
How long has mass been growing?
Approximately a year. It started out really small, and it really wasn't much to it, and then it seems like over the last 3 to 4 weeks, it just kind of blew up into this.
That's pretty big. Right at the snout, on the nostril, you can breathe. This gentleman called me and was saying they had an eel that had a tumor on it. I'll be honest, I didn't realize that tumor was so big. This eel's tumor is right by the nostril, so what happens is it occludes the nostril and we run into a whole list of problems. So we are still eating and everything.
Yes, sir. She's active. She eats well. I haven't seen any change in her behavior since it started.
Right close to the teeth, too, Paul. I brought an electrosurgical tool. I'm gonna attempt to cut it away, and hopefully we're able to get this thing out.
Sounds good.
All right, let's go get some stuff, guys. This is not like a farm call where you go out and see a cow or a goat and the farmers have a chute. You know, here we kind of got to make our own stalls. So we're literally bringing a whole surgery suite inside of the living room so that we can actually perform this surgery safely. So we're going to use a drug called Tricaine.
Okay.
So we kind of got this bucket to know exactly how much we need.
Gotcha.
When sedating animals we don't normally see frequently, we'll typically use gas anesthesia because we can control the doses. But a fish has no lungs. So what we do is we add an anesthetic to the water of a separate tank. We place the animal in, and while it's swimming, the water goes across the gills, and it becomes anesthetized. Now all we gotta do is get her in the tank.
When you lift the cage, she's gonna run. So if you kind of go ahead and get your net set up first, probably help you out.
Look at her teeth. Eels are apex predators. I mean, they ain't got a lot of things that will eat them, but they eat a lot of things. Once they bite you, they're a pretty nasty bite. Their teeth are actually backwards, so they're used to holding on to prey. I definitely don't want to get bit by this eel, so we're gonna be really, really careful.
Slide in behind you. Ready?
Yep. Whoa.
Oh, gosh.
Straight the back out on me.
Oh, man.
Yeah, come on. There you go. There you go. All right, you ready?
Yep. How heavy does she feel?
How we know she fully out?
You gotta stick your hand in there and see.
Okay.
Breathing good. Like she about there.
Good job, you.
Once we get Chastity in the right anesthetic plane, floating on the back, I'm thinking, okay, we're getting pretty close. You know, we're ready to take out and rock and roll. There you go. And then we're gonna do surgery on top of the neck.
Okay.
There you go.
You ready?
It's gonna be fast and quick. This is one of those procedures where this animal has to leave its aquatic world so I can perform this surgery. So we have to keep water flowing over the gills as well as over the body to keep this animal hydrated. And I need to cut quickly and precisely. Yeah.
Okay.
Brought an electrosurgical tool. So basically this machine cuts, but it also cauterizes at the same time. So there's a whole lot less bleeding than using an old-fashioned scalpel blade.
All right.
All right. Let's get ready to recover.
Did you want to do your scan?
Yep.
So we're looking for any kind of mass or anything?
Yeah, that's why I want to see if since it's there, I just wanted to kind of see. Obviously, we couldn't x-ray this ill, so what I brought was my portable ultrasound. And I can ultrasound throughout the body and see if I seen anything abnormal, any lumps or bruises or tumors on the inside. That looks good, bro.
Excellent.
Yep, let's go ahead and try to start recovery.
She's coming along. You see that gill opening right there?
All right, Miss Shasta, come on, girl. That's breathing pretty good. I think it was pretty hard, man. It was really hard. It definitely was a tumor. No doubt about it, it's a tumor. We won't know if this tumor is malignant or benign until we get the lab report back. But since this tumor was obstructing Chasta's nostrils, it was definitely lowering her quality of life, so it had to come off. All right, Polly, I need to hit with the end with no teeth.
All right.
Perfect. Right through the neck.
Yeah, I see.
All right, that's an antibiotic there, Brenda, and this is something for pain.
Was there anything I should do after this on the day-to-day as far as...
Just kind of watch now.
No medicine, no nothing like this?
We're starting to be reactive now. There we go. All right.
Oh, yeah.
Nice.
Look at that.
Nice. CriticFix's motto is we treat them all, and we did surgery on the moray eel, so, you know, it definitely includes all. I mean, eels need love, too, so fortunately we were able to get the growth off pretty cleanly, and the eel is doing well. All right, man, we up. We looking good. We starting to recover.
It's looking great.
Word out, brother.
Oh, thank you so much. I appreciate you guys. Eel surgery is not something that you hear about on a regular basis, but I'm so happy. I know Chastity's happy. In a week or two, I'm sure she'll be like nothing ever happened. I'm thrilled. I can't believe she's doing so well already.
Sweet. All right, guys, let's pack this up. Appreciate you, man.
Thank you.
Say cheese. He's like, nope.
Yorkie Morocco returns, teeming with anticipation for his test results.
Hey.
Hello, hello. How the baby doing?
We're good.
Okay.
So we were on schedule with eye drops.
Good job. So we got some results for you. What we have is called a lipoma, which is fat. They're not cancerous, so it's not bad.
Yes.
Yes.
Thank you. I'm okay because we're 9 years old and I know he's getting older, so we just have to be monitoring those things, but it's a relief.
Depending on where it is, most time we don't do anything about it.
Okay.
But let's say it gets in an area, it's under the arm and it gets real big and it's causing a problem as far as walking, we may remove it.
Okay.
In this case, it's not.
All right.
All right, so we got some good news today.
Thank
So
you.
Mama don't have to be nervous anymore.
No, great news. I'm happy. He's happy, he's gonna get a treat, and we're gonna go ahead and have some ice cream too. Yay! This is good.
Hey, baby. Hey, sweetie, I know.
Hey, what's up, y'all?
Dr. Hodges, how are you?
I'm fantastic, my friend. You all right?
Okay.
Been a while. What's up, girl?
Not much.
We've brought in our Western Hognose Amethyst. We've raised her for 3.5 years, and she's part of the family.
When we first discussed even getting snakes, I was like, no, I don't want those things in the house. I'm terrified of them. Don't bring them anywhere near me.
It's just become a passion, a love. We love them. We got a little issue here.
All right, what we got?
On Saturday, she started laying eggs. She's laid 9 so far, and now it's been 48 hours, and that one has not passed.
Oh, boy.
And I believe she's got more behind it as well.
You know, if an egg is stuck, it can definitely become an emergency situation. All right, let's go see what we got. I'm gonna go take a picture and see where it's at, and we'll go from there. Be right back.
Thank you.
All right. Hey, what's up, baby?
What you got, bro?
Got a hog nose that might be an egg stuck.
Okay.
I'm a little concerned, you know.
Jump in there and
Let
get
me
it.
get in here and see what I can do.
Okay, all right.
Amethyst is being presented with possible egg binding, which is when a snake can't pass his eggs. It's possibly fatal, so I'm hoping this isn't the case. Came up.
Wow.
Oh, boy.
That look like she got quite a few.
This is a nightmare. 1, 2, 3, 4, 5. Look like we got 5 eggs, and it don't seem like they're moving. I'm not sure if one hasn't broken. I'm gonna grab him. I'm just gonna talk to the guy.
Do you want me to bring her here, or?
Yeah. Definitely not what I want. This is about as bad as it can get.
Ooh.
Yeah.
How many sheep that lived in there?
5.
What's this here?
That's what I'm worried about. If that's broken, if that's open, that's what I'm worried about. We need to get these eggs out as soon as possible.
Oh, yeah, that's oof.
Bad.
I'd hate to lose her. She's part of the family.
You know, it's still gonna be touch and go.
Yeah. What do you think your chances are?
50-50.
Well, I know you guys are the best.
But I just want to be honest. This is
Dr.
bad.
Hodges, you've always been honest with me with every animal I brought in here, so that's why I come to you. We raise more than just snakes, and every one of these animals is family, and we love them. We treat them like family, and I will feed my animals before I will eat. I feel very confident that Dr. Hodges will do everything he can to save Amethyst, and if he can't, there's nobody better to work on her than him or Dr. Ferguson.
I'm worried about your little mama snake.
Oh my gosh.
Basically, I'm doing a C-section on this snake. This is a very tough surgery. I'm really worried about one of these eggs rupturing and causing possibly septicemia and killing this snake. All right, so I'm trying to milk all these things out of here. Come on.
That's some pretty delicate stuff you're working on right there.
Come on, you're the problem, egg.
Come on out there.
We got the one that's broken. We got one behind it that's giving me some problems. So that's our problem, egg. There's a ruptured egg. So my worst fear is here. I'm really worried about this snake becoming septic and possibly dying. That's number 5.
Number 5, that's right.
You want some saline?
So I'm just gonna use saline and try to flush this mess out directly in there. At this point, I want to get this area sutured up, clean, and get this baby out of surgery as soon as I can. All right, boss. Let's keep our fingers crossed.
Good job, Doc.
You, man, you saw 5 and got 5. It's up to the snake now.
It's up to the snake.
Yep.
I was able to remove all the eggs and clean out the wound, but Amethyst's prognosis is still guarded. Typically, I keep these snakes for about 48 hours afterwards. However, Amethyst's owner has all the proper tools and everything to nurse it back to good health. See how we do?
We'll take her home and put her in a nice warm bed. We're relieved that she's out of surgery. We're gonna take her home and do the best we can for her.
We ended up taking 4 viable eggs home to place them in the incubator in our kitchen.
We want many more years with Amethyst. We love her, and we just want her to recover and be healthy.
And thankful that we didn't have to say goodbye to her today.
I'm glad she's alive. I'm just glad she made it through the surgery.
That's a good boy. Good boy. Come here. Got a squirrel here. Is Nugget a good squirrel or Nugget a chomp squirrel?
I don't know. The good news is, hold on. Let's go see. The good news is you'll let me know.
Yeah, I will.
Come on, man. Come on. Hey, y'all. Got over here.
He's got an upper and lower teeth.
Abscess?
Yeah, abscess. He's got an abscess in the lower neck. I have a squirrel named Nugget, who I got as a baby. He was a rescue. He's very special to me. I take him everywhere. He's a house squirrel. He lives out among the whole house, and he's housebroken. Pretty rough, right?
It's pretty rough.
Yeah.
Have you seen any drainage?
Mucus externally?
Yeah.
No.
Go do a little dental x-ray, see if I can look and see exactly what's going on with that, too. Give me 1 second, my friend.
Very good.
Look like Nugget has some dental problems, which could be caused by abscess on his jaw. So Paula's gonna get this squirrel sedated so we can get a better picture of what exactly is going on.
You always gotta use caution no matter what you're working with.
You think our dental machine, the x-ray, is small enough to fit in his mouth to get some pictures?
We're gonna figure out something.
Rodents have a really small mouth, and I could take an x-ray with my regular x-ray machine. However, it won't show the details quite like my dental x-ray machine will.
You can see his incisors real good.
I wonder if his incisors are the ones that's causing the problem.
You might be on to something, Doc.
As I'm looking at these x-rays, these insides of teeth look like they're in pretty rough shape, so it makes me wonder if this really is an abscess at all. Come on back, my friend. Do you ever see his top 2 teeth touch?
I've never clipped him.
Yeah, okay. You see how that top one?
Oh, that's not supposed to be like that. That's supposed to be.
Be right there.
Yeah.
I think it's TMJ. It's hurt. It's more inflammation.
He
can't, right.
He's clicking his jaw to compensate for the screwed up front teeth.
Squirrels have what's called hypsodont teeth, meaning they don't ever stop growing. Typically in the wild, squirrels wear these teeth down, but because Nugget is domesticated, the teeth overgrow and it becomes quite painful. All right, Paul, let's get to cut it and then file it down. When the teeth don't touch, it's called malocclusion, which causes the TMJ or temporal mandibular joint to swell, and it's causing the nugget to overcompensate with those back teeth.
Looking good, man.
Becca, so how many days you been here?
It's been about a week now.
Okay, what you think about working with squirrels?
I'm actually allergic to rodents, so.
You didn't say I was allergic to rodents in the interview.
Should I have?
Probably come in contact with one or two.
It's Critifix.
Well, as long as I'm wearing gloves, it's all right.
Okay. Now that we've trimmed Nugget's teeth, we'll get him on some antibiotics and some special food so his nutrition can get back to the way it should be. We got that cut down where we touching, right? So hopefully we're on the road, man. We'll kind of keep feeding him and see how we do. I got an antibiotic here for you. The directions are on the bottom. I'm always here, my friend.
Yeah.
Pleasure.
Thank you so much.
No problem.
I can't believe it. After talking to Dr. Hodges and seeing the x-rays, my worst fears have been reduced greatly. I was expecting really bad news. These guys are great. I owe the squirrel's life to them.
Good point, huh?
Now, let me ask you a question. If you're allergic to peanuts, would you work in a peanut factory?
Why would I work in a peanut factory? I'm allergic to peanuts.
What about milk? If you're allergic to milk, would you work in a dairy?
I am allergic to milk, and no, I would not.
You ain't gonna believe this. One of our technicians, Rebecca, told me today she's allergic to rodents.
She's at the veterinary hospital, but she's allergic to rodents.
Should we ask anybody else if they're allergic to any other animals?
Man, I want to ask that question. It may give us the hives.
Exactly. Where's your dog?
Over there.
You put him up?
I mean, he was in the carrier. I didn't touch him.
Why you didn't touch him? You allergic?
It's rodents and rabbits that I'm allergic to.
Hold on. Paul.
What you got?
Now she's allergic to rabbits.
You're gonna build up an immune.
I take allergy pills every day. Because in my head, I'm thinking, I'll deal with it either way. Like, it'll be okay.
You been here all year. You allergic to anything? Cats. Lynn, what you allergic to? Any animals?
I can't get bitten by an animal because I'm allergic to penicillin.
Hey, come here. I'll give it up. They all allergic to animals. She's allergic to cats. She's allergic to rabbits and rats.
Sydney, she's also allergic to cats.
What kind of veterinary hospital do we run here? My whole vet clinic allergic to animals. Susan.
Yes, sir.
How long you been working in the veterinary industry?
14 years.
Oh, you allergic to anything? Animal-wise?
Cats.
Good boy. I'm done. I'm done. Don't nothing. Just nothing. Don't. I give up.
Hampton, you can relax. Hampton is my 2.5-year-old shepherd mix, and he is rambunctious. He is a toy destroyer. You cannot walk him normally on the street. He wants to be everyone's friend. But when he got lethargic and he wasn't pulling me outside this morning, I knew something was wrong.
Hello.
Hey.
How you doing?
Hi. Good, how are you?
What's going on with this baby today?
He ate his rope toy, didn't eat breakfast.
Okay.
I heard his stomach gargling. It wasn't even like a growl.
Got you.
And then he threw up.
Was it like yellow bowel?
It
or
was yellow
like...
bowel.
Okay, all right. It's important that we try to figure out what's going on, especially when it's strained, because they can get down and get the intestinal tract, and as the intestinal tract tries to move and do normally what it does, it can have what we call an accordion effect. And then the strain can cut your intestines there. So hopefully we can get it passed through and not have to do anything in surgery, but time will tell here, okay? We want to, first of all, start with an x-ray. We'll be right back, okay?
Thank you. Come on.
My concern is definitely high. I know that I'm not going to see the rope on the x-ray, but I'm looking to see if I see anything, if it's a certain gas pattern, any kind of bloating or anything like that, that would clue me in.
Here's your x-ray.
All right. I don't see anything that jumps out at me right now. We can see gas patterns in here, which may or may not be normal, but I think we need to proceed with the barium series, which is a special dye that they'll swallow, and we'll take x-rays periodically to see how this dye navigates through the intestinal tract. Over time, it'll start going out of the stomach, and what we want to see is see it come on out there and go on out. That means that there's nothing that's causing a blockage. Now, what I don't want to see is it gets to this point here, and we take an x-ray, and 2 or 3 hours later, and it's still right there.
Yeah.
And then behind it is a big gas pocket. That tells me there's something that's blocking it there, which means we have to go to surgery. So we're gonna keep the baby overnight.
Okay.
Because we're gonna give the, it's gonna be all right. Yeah, yeah.
If I was leaving Hampton with any other vet, I probably would be a wreck and have to stay with my mom. But I really trust Dr. Ferguson. I know that he really cares about these animals and will do whatever's best. I'm hopeful that this barium test will go well. And if there's anything in there, he'll pass it through and I can come get my baby tomorrow.
Chef Ferg.
Right. I hope he eats it.
I wouldn't eat that.
Put that special flair in it. Bling. Bling. That's magic.
Okay.
Oh, you don't think it'll work?
Look at it. That was so nasty.
We'll see. All right. Chef Ferg is on the move here.
He's not excited. So gross. He's licking his lips, though.
Eat it up, buddy.
Yeah. Wah, wah, wah.
Don't give up. Don't give up. You know that stuff tastes like chalk. That dog like chalk. He in the rope, man.
Bro, he's eating it. He cannot believe he's eating this right now. He's gonna lick the bowl clean.
My culinary skills are working. When you get him out, shoot a rat.
Okay.
After giving the barium, we take an x-ray, and we know that the barium at this point is going to be in the stomach. And this is a baseline for us, so that we have a comparative after taking further x-rays. You can see this large white area right here. That's the barium that we just gave in the stomach right now. So we'll see how it progresses through the GI tract. My fingers are crossed that there's a small amount of material in here, but not enough to cause a blockage, and this barium runs right through, and we don't have to do anything else. Worst case scenario is there is a blockage, and we have to go in and we have to remove it. We'll see how Hampton handles the barium over the next 24 hours. Hey, how was Chester, that eel that you removed the growth from the nostrils?
Man, that was one for the books. How long has this mass been growing?
Approximately a year.
I'm gonna attempt to cut it away. It was my first moray eel surgery, and I'm happy to say it's my first successful moray eel surgery. And even better, I didn't get bit.
Hey, cheers to that.
No doubt.
Hey guys, I just wanted to provide you with a little update on how Chastity is doing. Tumor removal site, where it was all white, it's now starting to grow to its natural coloration back with the black and white honeycomb kind of pattern, which I wasn't expecting, so that's awesome. She is incredibly active now. She's getting back to her old self. She's eating more than ever. And as far as I can tell, we're in the clear. There's no signs of anything regrowing at all. I still can't believe you guys actually performed surgery on her right where I'm standing. Every day I think about it, I'm still blown away by the whole process. So special thanks to Dr. Hodges. Thank you so much.
Hey, Jordan.
Hey, Doc.
I don't know why I have this foot itch. It just started when I was riding in the truck today. I think the itching is moving to the top of my foot now. I'm a little worried here, Jordan.
Maybe you're allergic to something. Just take it off and go at it one good time.
Oh, that's how you gonna handle me?
What? I hear allergies are going around the clinic.
When your hand itch, they say you're gonna get money. So what happens when your foot itch?
What?
You gotta give away money?
I need to find you something to do, Doc.
Where you going, Frosty?
What's going on, Frosty? Limping on leg and won't fly.
Frosty the parakeet hobbles into Critter Fixer, hoping to get the wind back beneath his wings.
Hey, give me a rundown of what we got going on, Frosty.
Well, about a week ago, he got his foot caught in one of the cage wires, and we noticed that he wasn't flying.
What's the friend's name?
Tropical.
So it's Tropical Frosty.
Tropical and Frosty.
Oh, okay. Poor Frosty.
Our parakeet Frosty hurt his leg. He hasn't been playing around like he usually does. He's been in our family for like 5 years. They'll get on your shoulder.
Sometimes I have them on my head and I would just walk around.
We love them very much.
Can you grip it all? Hey, you can't grip it all, can you?
No.
Yeah, boy. Let's go shoot a picture on it. All right. I'll be back.
Okay.
It's always, always bad whenever a bird is down the bottom of the cage because birds there at the bottom typically get eaten in the wild. Fortunately, I can tell Frosty cannot grip with that right toe, so I'm definitely worried about it. This is bad. You can see here, this toe is totally torn off. Yeah, you can see it, right?
Yeah, I see it.
Oh, man, I see why. He got a lot of pain there. He's bloody and hurting. That's why you won't grip, huh, Frosty? It hurts. Let me talk to the owner. So this toe, he's in a lot of pain.
Oh, he is?
Yeah.
Oh, no.
Right here, you see where it's torn up?
Oh, wow.
This should be attached. This toe that you're feeling is torn away.
Wow.
The wings look fine.
The wings are fine.
It's just a lot of pain.
Why is he not flying?
He just don't want to move. He just want to sit there on the bottom of the cage. I mean, it's so painful. I'm probably going to have to remove that, too.
Oh, I didn't know it was that bad.
A straightforward broken toe usually can heal on its own, but it's definitely not the case with Frosty. This area isn't healing, it's becoming necrotic, and there's no blood supply going to it. I mean, it turns all the way around.
Whatever is gonna keep him out of the pain. So I guess you can take it off.
Okay. Give me a few minutes. I'll be right back in there.
Okay.
Right now, my main thing is just getting this bird out of pain. I'm gonna give him some anesthesia, remove that dangling digit. I mean, anytime you do anesthesia with small parakeets, you really want to be extra careful because these guys will die really easily. The heart rate increases, they breathe really, really fast. And under anesthesia, this can get very tricky. This is a necessary risk because this bird is in so much pain. We gotta do something.
All right, Frosty.
Poor Frosty. If you look really closer, you can see where it's almost to the bone. Some bird is in a lot of pain, boss.
It is. You almost fix it.
Man. Removing a bird's toe can be a delicate procedure. The longer a bird is under anesthesia, the more likely it is for it not to wake up. So I need to get this surgery done as quickly as possible. How we doing, buddy?
Doing good so far.
All right, let me fix this bird. That's the bad foot. Man, I'm so necrotic that just came right off.
Not even bleeding.
Poor bird.
Able to sew that, Doc?
I'm gonna throw one through, and then I'll put some glue. The surgery on this bird was easier than I expected because the toe has started to necrose, the veins around it has started to heal, and it came off pretty easy. But now comes the hard part, waking this bird up. How we doing? What's your heartbeat? It'll sound like it's really fast. You always hold your breath until they kind of up. While an animal's under anesthesia, we always check the parameters. We're checking temperatures, we're checking respiration, we're checking heartbeat. However, this bird is not waking up, and I'm really concerned. Same, pretty fast heartbeat.
Come on, little birdie. Time to get up.
But still going fast. Look here, bud. I'm on, Frosty.
Want to just put him in his incubator for a second, get him a little warm?
Yeah. Now I'm really starting to get nervous.
Get some warmth.
Keep breathing. If this bird doesn't wake up soon, he may not wake up at all.
You're doing better.
Hey, look at you flying. Look at you trying to fly. Fly.
Just shaking off the anesthesia.
Hey, you alert? I'm really relieved that Frosty woke up from anesthesia. This just goes to show you that even with simple surgeries, there are very big risks. But it looked like this one paid off. Once we get antibiotics and pain meds on board, Frosty should be back to his old self in no time. All right, got it off. Guess who's trying to fly?
He's trying to fly?
Mm-hmm.
So you think he'll go back to flying?
That's my plan.
It's okay.
You see, he's actually even pulling his legs up under him now because he's not pain. You see how both of them are even?
Oh, yeah. Oh. I'm feeling a lot better knowing that Frosty's gonna be okay. And like, I was worried that maybe he was gonna die. I'm like, can parakeets live with like a broken foot?
I'm looking forward to Frosty playing on top of my head like how he usually does.
Yeah, in a couple days, hopefully Frosty is chirping at us early in the morning, waking us up like he usually does. Thank you.
You're very welcome.
It's a voyage of discovery as Dr. Ferguson, Jordan, and Ariana take 2 vet student interns on their first field case.
Look at the babies. They're so cute. That's so cute.
Good morning.
Hi. Good morning. We're in Byron, Georgia at Lazy Pines Farm. We picked up Cooney pigs, and these are quarantined away from our original herd. We have additional pigs at a different location.
All right, so what we got going on?
So we had these pigs. They came from out of state, from Iowa, Nebraska, and they have been quarantined almost 60 days, and we need to get them tested for brucellosis and pseudorabies.
Okay.
These tests are important because currently right now these diseases are eradicated in Georgia, and we don't want to spread them and bring them back. Once we get the all clear and the tests come back negative, then we will bring the other herd back over and introduce them.
Students, we heard brucellosis before, like, you know, dogs and stuff getting with your bacteria. And the pseudorabies, we test for it. And it's just a viral disease that can cause a whole lot of problems, from neurological problems to respiratory problems all the way to reproductive problem, which is the most important. And it can be spread. It's very contagious. So it's something that the government makes sure that we test and we make sure all animals are negative. She's done the quarantine process, so now it's time to pull blood and do testing.
Gotcha.
So we got to test y'all skills.
All right, let's do it. Ready?
Yeah, I'm too old, so I'm all right. Who we going to corral in?
Natasha, Black Beauty, Queso, and Mr. Boss. We're just gonna try and get them in here, corral them in here a little bit so that they don't have as much room to roam.
When you look at these pigs, it's definitely going to be a challenge. And these are probably the largest cooners that I've seen. That's a big girl.
Yeah, Natasha.
In order to test these guys for brucellosis and pseudo-rabies, we have to get them on their back so we can assess their jugular vein to draw blood, which is easier said than done. Which way you going?
We're going to go towards Doc. So we
Back?
can, push and flip at the same time, hopefully. Ready? We're going that way, Doc.
Watch out, watch out. Jordan has a technique that she uses where she kind of goes underneath, kind of push a little bit on top, and then roll it on his back. But Natasha's a little bit too big. She couldn't even reach the legs on the other side.
Maybe we can get towards us.
Let her come back around. Y'all got a Mack truck right here.
Yeah. Need a rope to tie up under that foot. I think I have a leash in my pocket. Can we get up on, if we can pull one.
We just reach under and try to grab the opposite leg.
Let's drop it, let her step in it. Ready? Ready? 1, 2, 3. Keep going.
Be careful, Jordan.
Grab that foot. This fence is not helping. We gotta
Y'all
get
pull her.
that way.
You know, it's difficult getting blood from the pigs because you can't visually see the jugular vein. We know our landmarks, but we're still sticking in the area, and we have the vein that's probably as large as a straw. It's very difficult.
Thank you, Lord.
Pretty good.
Thank you, Lord.
You can let her up.
All right, ready? 1, 2, 3.
Roll her up. You gotta help her.
There we go, girl. I'm getting way too old for this mess.
One thing about it, if you can handle these cooners, we can handle any other cooner.
If we can handle Natasha,
All
we can
down
handle
here.
anybody.
With the heaviest pig out of the way, getting blood from the other baby is gonna be like a walk in the park. Next up, Queso. Right at the bottom leg. That's good, hold up.
There you go. Good job, Doc. Good baby.
2 more to go, and we have Black Beauty.
All right, pull it back. Good girl, relax. There you go. Okay.
That should be enough.
They are strong.
Now look around and I see Ariana, knees all dirty, and I see Jordan, knees all dirty. But I look at my little new veterinarians here that's coming up. They have on black and they're all clean. So we have one left. It's time for them to do a job. So this time they're in charge of holding.
This time we in charge of what?
Y'all the flippers and holders this time.
Okay. I can be the holder. The flipper, I'm a quarter of that pube.
You about right.
You about half.
You might be here. I don't want them leaving saying that they got to see everything. I want them to say, I was involved in some of it. This is a great field trip for our interns because not only do they get hands-on experience with the animals, but they also get to work in a governmental program that helps to eradicate diseases.
All right, now, ladies. Atta girl.
All right, that's
Good
good.
job,
Right
ladies.
there. I'm blown away. They were able to get that pig on his back in no time. They learn from the best. Blood drawn quickly, and we're done. Good job.
First.
Good
Hey, I
job.
get points for finding the vein.
Jordan.
Okay.
Good job.
Yeah.
Finally, we got blood from everybody. We'll get all this sent out to the lab, and hopefully these will be back at least within a week for you.
Okay.
Okay?
Thank y'all.
All right, let's clear it out.
We are very thankful for Dr. Ferguson and his team because without his team, we would not have been able to get those samples. I would not want to load them all up and have to drive into town into a clinic and have to do that in town.
Whew, a little less talking, a little slower walking all the way out than it was coming in. Huh?
Yeah, I done did my workout for the whole week.
How many appointments we got this afternoon?
One too many.
Yeah, that
Whatever
sounds
it is.
about right. Come on, let's go potty.
Hey, buddy. You ready to go outside? We put barium in food and helped the dog ate all of it. This morning, I want to see if he's going to defecate. I want to see what it looks like. Then we're going to come in and we're going to start taking our x-rays. See if that barium is moving through that GI tract. And if it gets to a certain point and it gets held up, then we know we have a blockage there, which means we have to go to surgery. Hopefully, it progressed a good ways.
Go potty.
something
Number
else now. We need
2.
else.
That's what we need.
You can do it, buddy.
Go potty.
Uh-oh, I think we're ready.
There we go. Good boy. You were holding it, weren't you?
All right. That looks like Barry to me.
Chalky, yeah?
All right.
A little soft.
Probably from that meal I cooked him yesterday.
Yeah. Good boy.
That's a good boy. Yeah.
You did it. Good boy.
It has kind of a milky looking color. I'm gonna get some and kind of work through it a little bit. I just want to see if there's any foreign material in the stew, but right now I'm feeling real good about it. I just want to see if I can see any rope material in it.
Thought. Smell bad?
Yes.
So gross.
I don't see any big stuff in there. I definitely see rope fibers. Let's go take some x-rays and let's see what this barium looks like on x-ray, and hopefully it's passing through. If that barium moves through, it definitely could mean no surgery, and we can get this baby home today.
Good boy. Good boy.
All right. We're looking for barium. It should be at the back of the colon area and defecate some, which we did do. He got a little bit left back there. Why he didn't kick that on out? Did you rush him, Joy?
Did I rush?
He got a little
It's
bit
sitting
left.
right on the
sitting
edge,
right there on the edge,
isn't
yeah.
Why didn't you let that go when we were
I
outside?
know, yeah. What I didn't want to see is I come in this morning and it's still a lot of barium in the stomach, and there's a small amount in the small intestine. But it's like it's moving all the way through pretty good. So this is really best case scenario. I'm gonna talk to the owner.
I heard it, Mama.
No surgery. Don't let this baby go home today.
Good. Hi, Booba. Oh, don't hurt Mom.
We pooped out a little bit of that stuff this morning. In the
Okay.
poop with some rope fibers.
Okay.
And we may keep pooping, but I want you to still monitor, okay?
Okay.
We got meds for you. This one here is for vomiting, and you get 1 tablet a day.
Okay.
And this is the antibody for the GI tract, because even though he's passing it through, it's probably gonna cause some irritation.
Okay.
You wanna make sure everything is good twice a day, 1 in the morning, 1 in the evening, okay?
Okay, thank
But
you.
everything else is good, and just let me know how we're doing. Really don't need a recheck unless something
Unless there's something
changes.
wrong. Okay.
All right.
Thank you so
All
much.
right. See you later, buddy.
Thank you. You
All
have
right.
a good one.
You too.
I'm really happy. Hampton, he didn't have to have surgery, and he's ready to go home. Moving forward, no more rope toys for Hampton to make sure that this never happens again. I just don't even want to risk it because he's very special to me. Come on, Hampton.
Good thing Hampton is allergic to rope toys.
If that was the case, it'll be a whole nother ball game.
Oh, good thing you ain't allergic to barium.
Or dog food.
Or roping gigantic coonie pigs. Oh, wait. According to Junior R, you might be allergic to restraining coonie pigs.
Keep going, keep going.
All right, be careful, Jordan.
We need to get them tested for brucellosis and pseudorabies.
Hold on, you know, back in the day, I would have been the first one to go out to flip that pig. But my old knees ain't what they used to be.
But in all seriousness, did you get the results back?
As a matter of fact, I did.
So what are they? Don't hog the results.
Well, don't be pig greedy. I called the owner, I gave her the results. We'll let her tell you.
Since Dr. Ferguson and his team were here last, we have received our brucellosis and pseudorabies tests back. They believe they both came back negative. That allowed us to introduce our 2 herds. Waiting on the test results to come back, we did have a few eventful surprises. We actually had 2 sows, Sparrow, in the pasture. We're super grateful for Dr. Ferguson and his team for being able to come out and get those blood samples and help us to make sure that everybody's going to be healthy and happy.